Hope you had a great time during the facility visit and a sumptuous lunch. So we start with the post-lunch session. So we have a very interesting panel discussion coming up with eminent distinguished medical practitioners and administrators. So the panel is on embedding translational innovation in health professions education institutions. I would request the panelists as I call out to kindly come up on the dais and take their seats. Dr. Gitanjali Batmanabane, Pro Vice Chancellor, Geetam, Vishakhapatnam. Dr. Brigadier R.K. Gupta, Director, Government Institute of Medical Sciences, Greater Noida. I think he's reaching soon. He's on his way, he's reaching soon. Dr. Tony Raj, Dean, St. John's Research Institute, Bangalore. Dr. Sanjay Pandey, Dean Research, AIIMS, Patna. Request Dr. Anand Bhan, Senior Advisor, BFI, to kindly join up on stage as the moderator of the program. Requesting Dr. Anand to initiate the discussions.
So just a minute, please attach.
Okay, I can use this one.
Oh no, use both.
Okay. Okay, I think we'll get started. If I can request everyone to kindly settle down, and if we can close the gates at the end of the hall. Yeah, thank you. Good afternoon, everyone. Good afternoon. I can't hear you. Come on. I thought we organized a good lunch, so we'd probably have a more vocal audience. All right. So I think we have an exciting panel to get us started. I know we are a few minutes late, but as you recognize, Delhi can be a bit brutal traffic-wise on a Monday, so there were some delays with guests coming, and I'm sure more people will join in. So what we thought we would do, just to get energized prior to the official sort of exchanges of MOUs, LOIs, etc., is have a discussion. And the genesis of that discussion comes from some of the sort of lived experiences many of us have had. I started my medical school journey almost 30 years ago, so 3 decades ago. I don't remember in my MBBS days any exposure to innovation, entrepreneurship, physician scientist pathways, etc. And that I think was probably the case with most health professionals in their training, right? And now things have changed quite a bit since then. I think certainly research is now center stage more, partly because I think more faculty members are interested, because MD, MS students, DM, MCH students have to do a thesis, etc. Some students are doing it because of ICMR, STS. Then there is the issue of also publications, there are rankings, etc. But I think what we really don't still have is a very active ecosystem in health professional educations. And we thought we'd get started by speaking to a very esteemed panel of experts, senior leaders from institutions to try to ask them what we could do differently. Some of them have already started to bring about change in their institutions. They are in many ways leaders in this space, and so we'd like try to learn from them. So very quickly to introduce the panel we'll start with Professor Gitanjali. Dr. Gitanjali is originally from JIPMER, did her MBBS and MD from JIPMER, clinical pharmacologist, then has also led institutions like AIIMS, Bhubaneswar, been in charge of multiple other AIIMSs like Patna, Kalyani and Guwahati as in charge director as well. And she was also at WHO CRO, where she was a technical officer for essential medicines, and now is the Pro Vice Chancellor of GITAM, deemed to be university at Vishakhapatnam, and is joining us today in that capacity. Dr. Brigadier Rakesh Gupta is not yet joined us, but he's on his way. Dr. Brigadier Gupta is the director of the Government Institute of Medical Sciences in Greater Noida, and where he's completing his second full term as the leader of the institution. This is a institution which is a state government medical college, but is unique because it has an incubator, has many research projects, and is one of the few institutions in India in the government sector which have actively looked at incubation as an important space. Also joining us today is Dr. Tony Raj. Dr. Tony Raj is a physiologist by training. He's the dean of the St. John's Research Institute in Bangalore, and where he also heads the division of medical informatics. He is a professor there, and he has been on the faculty for almost 30 years with a lot of interest in metabolic physiology, essential amino acids, and insulin sensitivity measurements, and of course is very much involved in steering the St. John's Research Institute towards becoming a leader in this space in terms of research in the country. Also joining us today is Dr. Sanjay Pandey. Dr. Sanjay Pandey is a public health specialist with an MD in community medicine from IMS BHU, and he has over 20 years of experience in the field of community medicine, has served in various institutions including AIIMS Patna, the Government Medical College Haldwani, IMS BHU, and currently is the Dean Research for AIIMS Patna, and also the faculty in charge for the Center for Rural Health, and head of the Department of Community and Family Medicine. So as you can see, we have tried to pull together a very exemplary set of experts who will tell us a little bit about what we can do in this space and how we can perhaps further catalyze health professional education institutions to do more. So I'll probably start with Dr. Gitanjali, if I may, if you could use one of the mics. And Dr. Gitanjali, you've been a clinical pharmacologist, have dealt with sort of the research space. You've also led institutions like AIIMS Bhubaneswar. What do you think are some of the biggest gaps in terms of ensuring that our institutions are able to encourage good quality research, which is meaningful in terms of impact? So it's not just research because we want to do a project or we want to publish, but something which brings about transformative change for patients, for communities, for public health.
So, thank you everyone, and good afternoon everyone. I'm really happy to be here. I am giving my experience, or I will be sharing my experience mostly as an administrator, because I've been that for the past 10 years, and a little bit as an educator. So one of the issues which we face here goes back to how medical colleges were really formed. If you look at the medical colleges or the health institutions in India, basically they were done for two things. One was for teaching and the other one was to take care of patients. So all the doctors, all the faculty, all that they did was to teach, or they took care of patients. Research was never on the agenda, except for some institutions like AIIMS New Delhi or PGI Chandigarh, and few like CMC Vellore and maybe St. John's. But even in JIPMA, the research was not a focus. So this has come on much later, and I would say that especially because of the focus on research and the fact that we are being now banned using some metrics on publications that shows the importance of research in our community. And so that's really because this ecosystem is slowly evolving. So that's one. Number two, even to do good quality research, there needs to be people who are trained. There needs to be people who, even ethics committees in that sense. There are not many ethics committees which are comfortable even, looking at projects which are a little bit challenging or, little innovative in my this thing. So we have that. And the other thing is, what are we looking at? People will say, why should we, we are being, what shall I say, assessed. Faculty will say we are being assessed by the number of publications, by the number of grants. They are not looking at whether we are doing actually innovative things to, take things to the community. So the way we are assessing faculty, the way their incentives are given, this is not in keeping with what we expect. So as we start slowly changing that, otherwise we are going to have people who are going to game the system. They are only looking at number of publications, H index and so on. So the major gap is this, and we still work a lot in silos. The pharmacologist doesn't know what the medical person wants. They don't know what the community wants. So we are just kind of. So these are, in my opinion, these are the major impedances to doing good quality, work, which we need to talk across specialties and come together.
Thank you. So I want to pick on one aspect. You have been an integrated part of JIPMER's medical education department. The NTC has been involved in training medical college faculty in the region and beyond. And we move towards competence-based medical education, right? So is there something we need to do in terms of our health professional education ecosystem, how we deliver, so that perhaps we made it core to becoming a good quality practitioner is an understanding of the role of good quality research, innovation, in bringing about change for patients, communities, and public health. Do you think that would make a difference? So then it becomes core to what it really means to be a graduate from such an institution.
I think that's very well said, because I am not a big fan of the present CBME curriculum as it has been put out by the NMC. For one thing, I mean, in JIPMER we didn't follow it, neither did we follow it in AIIMS Bhubaneswar or any of the other institutions. But the fact that it is now the last 4 years that I have come to know about this curriculum, I really feel that it is totally messed up. And they pay lip service to things like, you have to think of innovation, you have to be creative, you have to, this is just lip service. You can't teach it in 1 hour or 2 hours. And so basically we have not changed anything, because the way it is still, all the students are focused on exams. So we are only looking at how good are you in passing exams. So until we change that, not only for undergraduates, for postgraduates as well. So that thinking has to start early, and yes, it is definitely very important. And I won't say it should start only with the MBBS. It should start much beyond before that. From schools, we have to get them into this kind of thinking and trying to solve their own problems.
Thank you. Maybe pivot to Dr. Tony. So Dr. Tony, you work here.
Ma'am, but you have said, because you are in INIs and AIMS, but in other state and other medical college, also the private medical. The problem is, this is an excellent program, this new NMC guidelines or curriculum implementation, but it is not practical. It requires a lot of huge manpower, even in the state government. The way the medical colleges are spending, number of MBBS seats are increasing. You cannot actually practically on the ground implement this CISP program. So it is difficult. It will take time. It is being followed in Europe or abroad for quite some time, but it will take time. It will implement, and I think such component and innovation need of the day, it has to be part of it. Abhi utna nahi hai, but I think over a period of time, once it is fully implemented, we have a good number of faculties, then probably I think it is doable. It will come. It will take time.
Thank you. Dr. Gupta joined us. We got started from JIMS Noida. He leads the institution. So we introduced you in your absence, but thank you so much for joining. Dr. Tony, you are at SJRI. SJRI, for many of you will already know, is located in Koramangala. Koramangala probably has the highest density of startups per square feet, maybe, if I would say, in the country. And I'm sure you are inundated with requests to collaborate. But from an institutional perspective, how have you been thinking about building this kind of a network where you work with partners, but you also institutionalize the idea of innovation as a key aspect of health professional education and working with the various disciplines?
Thank you, Dr. Bhan, and thank you, Blockchain for Impact, for putting this all together and to really create this momentum. Coming back, I'll start off from where Dr. Geetanjali left about how medical colleges have evolved, and just to give you a story about how St. John's as a medical college moved into research with a focus. In about 24 years ago, they teased out a separate administrative entity just to focus on research. And it's taken us some time organically to grow and give that focus to different types of research, from public health to bench work. But somewhere around 2017 and 18, there's this need to really address the innovation bit as well. And while we were doing research, we were collaborating. Uh, like any research, a lot of it just goes into publications and metrics, and how much of it is actually hitting the ground or making an impact is what we were concerned about, and we brought this up, we debated. And the way forward was to create a new entity, which we had to tease out of our, we are a society, so we had to tease it out, and we created a Section 8 company and called it St. John's Health Innovation Foundation, with a focus on not only encouraging innovations within the student community, faculty community, but also within the whole ecosystem. And as you said, we do keep interacting with various startups, not only startups, but very large groups as well who have ideas. And the focus is, our catchphrase for our innovation foundation is health innovation for society, which means there has to be an impact. And so we are very picky and choosy on ideas. And one of the things is to identify needs. In med school, we are trained on problem solving. We triage and we solve a problem. And we move on to the next patient. And because our clinical loads are really high in our country, we're just moving on to the next patient every 3 minutes. But when you do a 50,000 foot view of a community and see what problems they have, and then deep dive into that, you'll realize there are so many problems that can be solved. And there's so much of technology that can address these problems. So we've taken some of these approaches in our innovations as well, and the groups that we work with, to try and make an impact. And I think we're hoping to see, some momentum in that direction.
Thank you so much, Dr. Tony. Brigadier Dr. Gupta, you come from JIMS, you've led the institution now for many years. JIMS, I think, is very unique as a government institution with a Section 8 company. So what sort of spurred this idea of setting up the company and focusing on innovation as a core aspect in a government institution?
Thank you very much for making part JIMS in this very prestigious panel discussion. And we are actually located in Greater Noida. And we have a model which can be doable, which can be created if there is a will. Dr. Rahul Singh can show you of this. He is the man. I don't take credit, I am heading the institution, but Dr. Rahul is the CEO. He is like a Hanuman. You give him the task and he will do it. And we are only 7 years old institutions. Started from scratch. So from hospital, academics and research. So it will take little time. When I started, I served 33 years in defense, and then I thought we must do something innovative. So our whole institute is more innovative. We have done a lot of innovations, and यही था कि government से you cannot expect more funds. So we thought कि rather than just increase the you have to maintain quality, and then you have to make it self-sustainable. तो हमें हर जगह देखता है कोई भी काम करते तो हमें लगता है कि it should be more cost-effective and it should self-sustainable, so that because in government it is very easy to buy capex, but opex is very difficult, right? So in the beginning only we thought we started with our 3 vertical pillars is one patient care, second is academics, and third is our research. So we started right in the beginning before the institute actually took off. We all 3, and whatever things is required, being a government, things were easy to making the scientific committee or ethical committee approvals, everything we have taken. So we started on 3, and actually academics and patient care, actually research has actually helped the patient care. That is what hamara aim. So we started 2019 and 2021 we had a COVID, so but we did not stop it, we carried on, and that is the time we started. We thought, okay, why not? Government cannot give funds, so we took help of ICMR. So that is the time we started. We established MRU, multidisciplinary research unit, VRDL. We at genome sequencing, because that was required during COVID, right? And then we thought, okay, why not do some clinical trials? We are already doing during COVID, so we started clinical trial, ICMR intent. So there are very few institutions where you got everything. And because of this, we decided, we have almost 25 extramural projects. So now there's multiple resources, but how to make best use of it. So we made a department of medical research. where we have MRU, VRDL, genome sequencing, state TB lab, clinical trial, everything. So suddenly we realized we have a huge manpower, we have a huge resources, and that is how we actually, carried on. And then Dr. Rahul came. He says we will start the first medical-based incubator. So then we thought there were multiple problems in a hospital. COVID actually, I thought we took it as a opportunity. Lot of problems during COVID we realizes, and we have to solve those problems. So we created medical incubator initially, and then of course we thought why medical incubator? Again we have to make it more of a self-sustainable. So we thought we will make it a Section 8 company. One, of course, to decentralize. Government, you have got a lot of foundations, so we wanted to make this model is more of a decentralized, which is free to work, which can talk to various companies, legal things, one to one, and make it again most cost effective. So what we thought it, since it was not made in any of the government institutions, so we started again from the scratch. There were a lot of hurdles. We took model from IITs, UP government, other private. It is not difficult to make the Section 8, but to make the Section 8 company in a government institute at a medical college, which is non-profit. Now, advantage of this, the head of the institute is actually, uh, when he changes, it keeps changing. So he remains a sort of a chair. And then probably this becomes, so it carried on. Then we got Section 8 company. Now we got funding. Then we thought we will do AI we are doing. Then we also got a bionest. So everything is coming the way. So my intention is very clear. So मेरा यही है, काम करने वाले young लोग होते हैं, but decision लेने वाले. So if the head of the institution decides कि काम करना है, so there are people like Dr. Rahul, they can implement it. So I think this is a very good model, and I think it is successfully being implemented at HIMSS.
Thank you so much. Good day, Dr. Dr. Sanjay, I want to come to you. Now, like IIT Delhi, you are an institute of national importance, AIIMS Patna. There comes, there are certain freedoms of being INI, for example. You are probably not as constrained by NMC norms, which Dr. Geetanjali was speaking to. But in a relatively new institution, there is also an opportunity of perhaps redesigning or creating an institution which thinks differently, operates differently. So in the newer institutions like relatively new institutions like AIIMS Patna, how can we perhaps work towards innovation in health professional education, ensuring that our clinicians, our faculty, our residents, our students are exposed to the idea of these pathways so that they perhaps can become the innovators of tomorrow and come up with solutions. A surgeon who's a medical device innovator, right? Or an endocrinologist who develops drugs and is not dependent on a pharma company, but also comes up with his or her own ideas and develops it. So any thoughts on this?
Very good afternoon.
Others use this one, make a cross.
No, sir, it's not on.
You use this one, sir. I'll switch. Niches.
Okay. Just before starting of this session, Dr. Anant, you have said that just 30 years back when we were at the undergraduate MBBS and we just know only to how to read, just to read the medical science. The aim was to dedicate ourselves to the patient care and resolve activity. We at that time were never thinking about what is the research and what we should do. But the time has changed and the research and the need of the research has also increased by the time. So when the research time, when we are with the MD students, we do not know what is the need to publish the data, publish the research. So as Madam has rightly said that now some things have started, like promotion and the job appointment. So all these requires for the publications, how many publications you have, how many research projects you have. So here is the two important things: research and the research projects and the innovation projects we are doing in the day-to-day life activities. But the innovation in day-to-day life, what we are getting, particularly from the clinical sides, the clinicians, they are working. They are basically the person who has some idea, and this idea has to be come into the shape. So this is the most important thing, and in such situations, the constraints has already been described by by senior colleagues, that what we constraints usually we are getting, particularly in the state governments, and that you will have to, if you want to do something, if you want to develop some new facility, you will have to go through the various kind of the government norms, approvals, and these all things. So, but fortunately, as the government has started this setting of the INIs in the medical field, these INIs has, or though they are autonomous, they have some autonomy, they can do the activities, they can establish the facts, they establish the institutions, but still, the I cannot compare AIMS Patna, AIMS Bhubaneswar, AIMS Jodhpur with the AIMS Delhi, because they are already established institutions. They have passed this all kind of these barriers, and these new AIMS, these new INIs, they are still struggling with the some of the official formalities. However, the government is supporting us, and fortunately, I am just happy to say that we have started the incubation AIMS Patna Incubation Innovation Center, which has started in 2024. So this is an welcoming step by the DST, that now in the real terms the innovations are coming out. Means that if any person, any surgeon, any doctor is, any clinician is working inside the hospital, they want something. If I want to change this one, where I should go, what I should do. So such kind of the incubation centers are the most appropriate platform to develop their ideas. And we are fortunately, the INIs has the some of the liberty to, they can move ahead. And this kind of the liberty, it should not be confined to the INIs. It should be must percolated through all the states and the state medical colleges for welcoming such an idea. Just now we have called for the ignition grant call. We have got more than 200 applications. We have got more than 200 applications, and in that applications, almost 10 to 15% applications from the undergraduate students. So fortunately, in the AIMS Patna, we have the some of the liberty, and we are getting the support from our administrators, that we can start these all things, procuring the process, following the rules of the procurement, and these all we are getting. We are getting benefits being an INI. So this is one of the most important thing, that why and how we are moving ahead. So this is very important, and for this kind of support from the government must be to all the government institutions, not the government, all the medical institutions, so that they can bring their ideas.
Thank you, Dr. Sanjay. Dr. Gitanjali, if I could go back to you. Now, when we talk about innovation, when we talk about technology, I guess one of the concerns is, would that impact ethics? Would that impact clinical judgment? Would that impact the way we empathize with our patients? So how do we find that balance, and how do we ensure that is center stage in our teaching as well, in health professional education, that yes, technology is important, innovation is important, but at the heart of the practice of healthcare is empathy, ethics, clinical judgment, and the enabler kind of conversation.
So I'm very critical of the CBME curriculum, but one of the good things they've got it right is they have something called an ATCOM module, that is attitude, ethics, and communication skills, which is a great thing. At least we are teaching them now, the students. It's being taught. But the thing is, how it is taught, that is, in my opinion, that's more important, because you can't teach empathy by taking a lecture on empathy, or how to be kind to altruism by having a lecture, or just showing a movie and not knowing how to actually debrief and things like that. But having said that, there is a lot more emphasis on these aspects, because now it is formally included into the assessment as well. So it has come back in a big way. Also, the medical councils are now insisting that interns have to undergo a course, postgraduates have to undergo a course before they get their registration done. So I think there is a lot more emphasis on this now. But what I would like to see are more things like role models. I mean, when we were students, we had excellent role models. I'm not sure whether we are the right kind of role models for our students, but those kind of things they need to see because of the large numbers. They're not actually able to see things happening at the bedside, or the things which you make a connection as a student. That's not happening. So those are some of the things which I generally worry about, because in India we have this huge power distance, and hierarchy is at its worst in medicine especially. So students are not taught to question. Your boss says something, do it. Don't ask why it is done or how it is done or can I do it better. So these are some of the things which actually make the innovative juices flowing for our students. But as far as ethics is concerned, I think we are going in the right direction in medical colleges.
Sure, that's encouraging to know. Dr. Tony, intentionally BFI has focused on saying that we're not just supporting health innovation or health research. We're talking about translational health innovation, and the reason is that, as all of us on the panel probably know, that even in our medical institutions, there are a lot of research projects happening. There are a lot of publications coming in, a lot of MD, MS thesis, sometimes undergraduate thesis, but they are in the moment, right? You finish a project and you move on, maybe do something differently, but perhaps not taking the innovation to a product or a solution, right? And if we were to truly want to change things, then that's the kind of meaningful journey that we want our staff and our students to do. So what can we do to encourage that, rather than just moving away from the one-year project model or the publication as the end point, to actually something which is discerning and tangible in terms of bringing about change?
Sure. I'm again going to take on from where Dr. Geetanjali left. I see this whole dovetail of what we call creativity, and in the design world, in technology, the design thinking, dovetails into the whole ethics and empathy that you have for a problem. And this is a few experiments that we've been trying to do at St. John's, trying to understand why digital technology fails so often. Because someone has created a solution and trying to push it down someone else's throat, whether in primary care or in tertiary care. And there's a huge burnout at different levels. So one of the things is to try and empathize with individuals, and that whole design thinking framework will finally lead to transformative, kind of approaches in medical schools. But coming back to examples in India, where I'm not sure how many have heard about the collaboration between IIT Bombay and Tata Memorial to create a product which is a cell therapy product. There are what we call CAR T cell therapies, which are used to treat certain types of cancer, where you take a cell from the individual and tweak it so that it only attacks a particular cancer cell. Now, this is a product today in the market, and that's a fantastic example of a technology institute working with a healthcare facility and coming up with something that is still supposedly the lowest in the world in terms of its cost. So that's one example. CMC Velo did something similar. Technology which was sitting in a US university for a long time was brought into India, of course with Government of India funding. And finally, they published a paper on gene therapy for hemophilia, which is otherwise an incurable disease. And it is a genetic disease. And that now today, it could be a product where patients who got this therapy are surviving. Otherwise, it costs 20 to 40 lakhs a year to keep these patients alive. So there are very good examples of how technology can become products, and products which are affordable for our country or our people. And I think a platform like what BFI is creating and what the Government of India is also creating through the ICMR and through other modes, the ANRF which they've set up, is also very encouraging, because the time is ripe right now, and I think we should be heading in that direction with a lot of momentum.
Thank you. Dr. Gupta, public hospitals, public institutions, gyms is a very good example, could serve as a very important platform, sort of the next frontier for bringing about innovation, which is especially focused from a public health perspective, which is in line with local health needs, etc. So, how do you suggest we can encourage more institutions like gyms to get into this kind of thinking and sort of working on this space?
Thank you very much. So just to enumerate some more gaps. Firstly, now mindset of doctors has to be changed, and especially public hospital, they are really busy. Time, I feel, is not there. They can invest in research unless they get some help in terms of maybe they get some ICMR projects. If the ICMR is coming out with various, short and intermediate grant and a large grant, huge number. Every month we are getting a lot of projects, and we are taking advantage of it. So you get resources, you got a human resource, you got a research associates who actually at least can compile. Now, second gap is data. We are still not, digital in terms of, maximum OPDs, IPDs. So we are not converting our data into the useful information which can be utilized for the research purpose. So that we need to. Thirdly, research thing should be inculcated right from the beginning. And ICM also, they are also encouraging MBBS first year students to the STS projects, short term projects. So we have almost got this year 9 projects. And there is a huge competition. We got a 30 odd projects, out of which 9 have been selected. Those 21 also we are trying to do at our own institute level. So I think there's a sort of a competitive, they have a, ignition in the students, then they can do it. And secondly, my suggestion is, see, research is being done, especially this innovations, where we have a help of engineering colleges. Now we see all, जहाँ पे भी है, KGMU, I'm sure, St. John's and the other colleges, they are affiliated engineering colleges. We are also looking partnership, though we are doing it, though we have some, projects with IIT Kanpur, some from NIT. So we are actively actually looking, support of IIT Delhi. If there is some sort of a, MOU or some sort of help from IITs, and there should be a compulsory, at least maybe like engineering, got a 6 months attachment to industry. So I think they get in a healthcare also, if they get some attachment, they stay there, they feel the problems, they bring out solutions which is Indianized, which is required for actually the, your SDGs or national importance. Probably I think this is a doable model. Again, I said institute to institute they differ. We could able to do it. I think anybody can replicate those models. So I think right from beginning, we also made some scientific club, right at students level. So they also be giving some projects. There were inter-college competitions also. So I think you have to make culture in the institute where research, and they also need to be sort of incentivized in the sense of maybe in terms of some extra marks or some extra recognition, they give some award during various foundation to others. So I think there are ways and means. If the person on top hit that side, it is doable.
Thank you, very Dr. Gupta. Dr. Sanjay, some of the newer INIs have started to set up these departments of translational medicine. There is some talk about potentially launching new academic programs. Do you think there could be the possibility of having like an MD PhD program, so a physician scientist track, so that you are actually training right from the beginning someone who wants to very clearly perhaps do clinical medicine but also be an innovator, right? And if we had programs like that, do you think there would be uptake? What can we do to encourage more people to do it? The other thing I wanted to ask you is, why is it that in our medical colleges or our health professional education institutions, there is the ability for us to have adjunct faculty, right? So why can't we have perhaps folks from engineering institutions, management institutions, technology institutions as adjunct faculty members? Many of them might not even want the honorarium, just enjoy coming in and teaching. So is that something that we can explore in our institutions?
You have rightly said that sir has also told that for such kind of the innovations and all these things, so MOUs are very important. And just for I'm just giving the example of AIIMS Patna. We have the MOU with the IIT Patna, NIT Patna, and with the IIMs. So adjunct faculty facility has been is in the pipeline in our institution to bring to make them collaborative system between the AIIMS Patna and these institutions as and when it is required for the special kind of the situations. And also you have focused on the MD PhD program. Already government has started this, the DST has started this activity. And we are also the part of the, we have, our institution has given the consent to initiate this MD PhD combined activity program. So it is a very enthusiastic activity because in the medical science, the PhD is not getting too much of the priority in the due course. The people used to know that I am going to do the MD, MS, and then the more is the DMMCs, that's all. So very less people are interested towards the PhD because PhD is a hardcore research oriented activity. So this is a very good initiative that MD PhD, once you will join the MD and again you will be continue as a PhD, so you will be more focused towards the research related activity. And we have our institution has given the consent, and in the coming years we will start it very soon. And I hope this is also a new innovation and new things, and institutions will the students, the upcoming doctors, upcoming the clinicians, upcoming the medical personals, even though from the public health they can be benefited with such kind of the activities.
Thank you,
Can I
Dr.
just add one
course.
this thing? So one of the advantages of being in an institution like Geetham is because in the same campus we have engineering, architecture, school of business. You know, everything is there, and so there is a pretty quite a bit of interaction which goes on. So I mean, I'm coming from Geetham, but there are a lot of institutions like this which have the same thing. So I think all the institutions should take advantage, especially if you are staying in the same campus, because we don't need a MOU or anything like that. You know, we all belong to the same university. So there are large number of institutions which have a similar kind of ecosystem.
And rightly, ma'am, even though in our institutions, when we are going to start the AIIMS Patna Information and Innovation Center, the IIT Patna, without any MOU, has helped us a lot, right from how to initiate the activity, how to do the formalities of Section 8 to establish the company act. So this is the one part, and also we have the MOU with the IIT Patna with other research related activities, especially the Department of Physiology and other, they are directly related, मतलब working together with the IIT Patna.
आजकल सर कोलैबोरेशन का जमाना है.
Yes.
So जहाँ भी अच्छा चीज देखो, and government is also open, like wherever you feel, you know, do lot of PPP, lot of, you know, private, they are good. So you can collaborate, and पहले अपना था सोलो सारा करना है. I think it's more cost effective and it gives value and it gives the better outcome.
Great. All right. So we're almost towards the end, but sometime during the session, we were joined by the founder of BFI, Sandeep Nelwal. Welcome, Sandeep. And also here is Dr. Gaurav, the CEO of Blockchain for Impact. So I wanted to ask you, as senior experts in this domain, that what do you hope catalytic philanthropies like BFI would do? So if maybe one area, BFI obviously is already working with all of you, but something that you would like to suggest a philanthropy like BFI focus on to again encourage transformational health professional education. Maybe we could start with you, Brigadier Gupta.
They can do lots of. They can do a lot. In fact, Gaurav ji, we had a short interaction. He has seen our institute and our will to do more. but not to do any shortcuts or anything which is not. This is we are a public hospital, public institute, and there is a national need. There are various factors how we can improve. Askal it is more NCD, non-communicable disease rather than the communicable diseases. So we have to focus on that, how we can reduce the infant and maternal mortality. So there are ways and means where we can do research, we can do innovations, and in right direction that fundings can be used. So I think lot can be do through CSR, through right, because government may not provide that much of resources and we need people. So it's not only money but also the people. If we get more human resource who can actually do a lot of screening, like we started non-invasive cardiology, we started cancer screening. And so I think there are programs where you pick up early and then probably you can do much good. So BFI can establish, they can adopt center, they can provide you, rather than provide money, I prefer they provide resources which is optimally utilized.
Yeah, thank you, Dr. Ban. I think an organization like BFI can really stimulate the ecosystem. They may have been stagnation in our existing innovation thinking, but as I mentioned earlier, we need to contextualize the needs. If you want to make translational or transformational innovations, needs finding at the grassroots, at every corner of our country, and then identifying those problems and then throwing it out to young people to brainstorm and solve that problem. I think that will go a long way. And I think an engine like BFI would really fuel that to a very fruitful direction.
I don't think I'm the right person to give any yarn at this point of view, but I am really very honored that you all chose to consider us. I think that's a big step forward, because previously it was only the government institutions, or if you had a AIMS tag or something like that, where you came into being recognized. And private institutions, unless you were CMC Vellore or St. John's, I mean, really you were not kind of in the running also. And so I think you're moving in the right direction. But I mean, I'm an educator, so I would like to see something more being done for the younger people, because I don't think we are still stimulating them at a much younger age, which I believe that's the time when we should start. And I'm not sure how it can be done, but I think somewhere down the line you need to think of starting much earlier. Thank you.
And this is very BFI. Your role is very important to act as a catalyst for the idea and completion and just shaping that idea. So your involvement in the different institutions is really going to facilitate the young persons with the lots of idea. And obviously your fund resources, I can say the money and man is also very important. Manpower means you can give the guidance to the institutions that how they should move ahead, because for the medical persons, they are the very isolated persons. They are whole and soul involved in the patient care. Your engagement will give them some way that how, apart from their hardcore work of the patient care, they can come forward for the innovations that can ease their work.
Thank you, panel. So I think we have just time for one or two quick questions. If anyone would like to ask the esteemed panel anything, Utpal at the back, yes, go ahead. You can also be loud, I'm sure. आगे आ जाओ.
They can also provide some scholarship, ideathon. There are a lot of things which can be done.
So I have just want to know one viewpoint from the esteemed panel, that if you take the case of engineering colleges or institutes, how they, first their challenge was to do the integration between their departments, for example, mechanical and electrical, and in that, and now like IIT Kharagpur and other places are also opening medical colleges. It really helps when you have a department or something in the institutes, because students can take electives there and start getting the exposure regarding that subject initially. For example, a mechanical engineering student can take energy subject and other and get that vibe of what it is and understand. So what's your viewpoint, like having medical colleges inside engineering institutes and having engineering institutes inside medical colleges or some other format, so that why don't we think of combining both in one place so that students can take electives?
You are right, actually. What is a thought is going on. In fact, Kharagpur and Kanpur, they are already doing this. And I said in the beginning, doctors को doctors का काम करने दो, but they should be facilitated by engineering graduates. NMC has started electives, which is 4 weeks electives, and then in 2 subjects. Now they take it more of a break rather than actually going for the electives, not more than 10%. Otherwise, they are not using this. It should be with some, at least for 6 months, right? It is not possible for medical people to go into the engineering for that much of time, but engineering people, rather they are going to the industry, they can come to the medical institutions and they can pick up something and they can develop that thing. And of course, the medical engineering colleges also, I think, those who are nearby, right? They also faculty exchange programs or probably student exchange program. So they are sensitized to the problems of patients and probably this doable. So elective is a very good idea, but it should not be just कि आप जाके elective करके आ जाओ. It should be some exam and some assessment and some score system should be there so that actually they do it.
Okay, I see I see 5 hands, but I think we'll only have time for 2. Maybe if you could, sir, go ahead, and then ma'am, if you could do your question.
Hello everyone, this is a very nice platform being constructed by BFI. I have a question especially for these new institutions which are coming up. For any innovation to really happen, it requires a synergy and collaboration with people from different fields. And as you rightly pointed out, existing scenario is there are silos. But one of the pertinent issues is how do you take care of ego? So basically what happens is you create a team, there is an engineer and there is a fantastic innovator who has no degree, for example, and then you have a professor from an IIT, a management guru from an IIM. Okay? And all of them are doing this ancillary in an ad hoc manner, and this poor chap who is really interested, passionate, wants to do it. How do you think that in such kind of a new age, version 10.0 innovation architecture, how do you plan to take care of this inevitable ego? Can you throw light on this, please?
So we'll just take all the questions together so that we save on time. Ma'am, you had a question, and then quick question, please. Yeah, short and quick question.
I am a surgeon by profession, but not a practicing one anymore. My simple thought, or rather very important question is, we have this panel accumulated here to actually talk about translation. How can scientific rigor be brought to industry, right? Not just in building expertise, but also bringing about commercialization. So how can healthcare universities, and I've studied in a few of them, so I can say that the actual exposure to healthcare industry from healthcare professionals during their phase of education, at least in my time, was quite limited. How is that changing now to bring about innovation and commercialization, which can lead to translation?
Sir, yeah.
I invented here from Karnataka. We are 3 hardcore primary healthcare practitioners, and what we find the research which don't address our day-to-day problems. The researchers they take up research which they're in isolation. When we talk about translational innovation, we need to find out the problem at the grassroots level. Today, 43% of our pregnant women are anemic. Today, we don't have a tool to screen with very low cost premium. When you want to screen a population of this kind, we don't have a tool which is cost effective. To that extent, we are poor in our research and innovation. How do you solve this problem? Thank you.
Thank you. All right, I'll allow one more question just in the interest of time, but I want a student to ask it. It could be a PhD student or a master's student. If you are a student, please go ahead. Yes, we want to hear the students.
So hello everyone, I am a PhD student in IIT Delhi. So I have a bunch of questions, but I'll ask only one question, short and simple. I heard ma'am was saying that we have a very bad hierarchical system in our education system now. So I just want to ask, do you have any suggestion, because hierarchies are the reason for stabilizing the systems also, as they have a deteriorating effect also. So do you have any suggestion for how we can make things balanced so that the disadvantages can be minimized, just like we see abroad, hierarchies exist there too, but there we see a little bit more stability compared to.
Thank you. So Dr. Geetanjali, if you could take the ego question and the hierarchy question together, okay. They're sort of interrelated, right? Egos get inflated the more up you go.
So to answer the hierarchy issue, see, hierarchies are necessary. For example, if there is a myocardial infarction and there is a code blue going on, you need to have hierarchy. Somebody has to tell, do this, do that. Otherwise, there will be chaos at that site. But having said that, we need to teach students how to ask questions to, without hurting the egos of the people at the top. Okay, I actually take a session on this for our students. I mean, it is up to us as administrators to put in place certain things which we can talk about, toxic workplace and about how to ask, have difficult conversations. We don't do that. And I think we need to get our students to be able to ask questions, at least question some things which we are doing if they feel uncomfortable doing that. Does that answer your question? Coming to the ego. The issue of ego. So there is no right or wrong answer to it. But I find that nowadays it is slowly coming down, and I also feel that when we train teams together, this sort of thing disappears. Unfortunately, we are not doing that enough, because we know, especially in the medical system, we know that if there is a heart surgeon who's operating, he operates and goes off. After that, it is left to the anesthetists, the nurses, the technicians to make sure that the patient survives, the post-operative care and things like that. Many times what happens is, in these kind of things, generally the people who are participating, they sort of, what shall I say, they learn on the ground. I mean, they sort of know how to behave, I would say. And it sort of works out in the end. Not all the time, but I really don't have any right answer. Like, if you have somebody who has a overinflated ego, how will you deal with it? I generally do things by having open sessions for professors, for heads of the institutions. I have, small group discussions where we openly discuss issues like this, which you have brought up.
You wanted to add something
I just
quickly?
wanted to say, you are right, egos are there, but egos can be minimized. And this is by improving the communication. Intra-institute communication as well as inter. If you got a medical engineering and a management college, everybody sitting on top need to improve the system, need to communicate better. So I think communication at top level, at horizontal, vertical, आप एक बार आके उनको चाय पिला दो, आप उनके यहाँ पार्टी चले जाओ without work, not go with work. So I think आधी problem solve हो जाएगी.
Okay,
so it can be minimized.
Thank you, Dr. Tony. How can you address the money question? We don't talk money. We sort of shy away from talking money. Commercialization. Quickly.
Yeah. So in terms of that, ICMR came up with an excellent policy on entrepreneurship in 22 for medical colleges, allied health, and I think that document kind of talks about how do you take an idea to a product and, of course, finally to commercialization. The challenge is it's still not being taught, and I think this is an opportunity again for a platform like this to encourage this and bring in management people, bring in finance people as part of the incubators, so that component where this whole value of death of startups occurs is where we need to address it by making sure that doctors understand what it means. We're always thought about ethics and, you can't commercialize, can't advertise. Now you have a product, and what do you do with it? You can't advertise, you can't market. So these are things we need to tease out and figure out how we go forward.
Thank you. Dr. Sanjay, the last question around, let's not replicate the Oxford wala research, the Harvard wala research. How do we do research which is relevant to Patna and Bihar?
And just I wanted to say, sir, you have told that in the last, we have almost 75 years after independence, the anemia is still prevalent in our country, and we do not have any tool to diagnose it at the very low cost settings. Sir, still in the last few 5 to 6 years, such kind of the innovations has been done, and the government has also procuring, even I know that in the Bihar they are procuring the hemoglobinometer. This is very cheap, and this is available to the all ASA. I do not know, many of you do not know the ASA. They are the ground level grassroots worker. They are appointed for the every village to take care of primarily to the mother and child health. So they are ANMs, the primary health centers. They have the facility to check the hemoglobin immediately. So point of care facilities are nowadays is going to be going very smoothly, and the people are getting the benefits. But the most important thing that there is a consistency is the most important thing, that the government rules and the government procedures still is the major blockchain in the consistency of providing such kind of the items. So obviously this innovations, that translational research has a very promising role, not only from the patient care at the clinical settings, but also from the public health perspectives, because the majority of the persons, they are remaining untouched with such kind of they are not benefited from such kind of the thing. So this kind of the innovations has a very promising role and challenge in the future for the public.
Thank you. I see my colleague Sanchita has already climbed the stage, which means she's threatening to cut off the mic supply very soon. But jokes aside, thank you so much to our very, very esteemed panel for this lovely discussion. Thank you for joining us. Can we have a group photograph? A very quick group photograph, please.
Sir, please come. While the group photograph is on, I would also request Dr. Anand Bhan to felicitate our guests, the panelists of the session. We have had a great engaging discussions during the session, and we hope we take these discussions forward offline as well.
Thank you.
Dr. Anand, request you to felicitate.
Thank you so much.
Dr. Itanji, Dr. Tony Raj, Dr. Brigadier,
Thank you so much, sir. Please.
Sincere gratitude to all the esteemed panelists.
Please. घर की शादी है.
We now move on to the next segment, which is an announcement of Leap Global Accelerator. The Leap Global Accelerator is an international acceleration program designed to give Indian startups access and pathways to enter international markets. The program is supported by Department of Science and Technology, Government of India, and run by Venture Center, Pune. BFI has now joined hands to support the next phase of the accelerator program. I now invite Dr. Manish Gore, Head of Incubation Venture Center, to take over the proceedings of the session.
Thank you so much. So, good afternoon, everyone. Welcome to the launch of the Leap Global Cohort, which is a celebration of 15 promising startups who are ready to take their innovations to the world. Today marks an exciting step in strengthening India's global innovation footprint, and we are delighted to have our esteemed dignitaries and partners with us for this milestone moment. To set the context of the today's event, may I invite now Dr. Premnath, Director Venture Center, to deliver the opening remarks.
Since we are behind schedule, I'll keep it very short. First of all, I just want to welcome all the guests out here. I'm very happy to have Dr. Ravinder Gaur from DST joining us today. Dr. Praveen Roy couldn't join us because I think there's a lot of activity happening in the PMO today. And of course, we're very grateful for the leadership team of BFI, Sandeep Nailwal, Dr. Gaurav Singh, and all our good friends, including Satya Dash out here, who are here today as well. This particular accelerator is an interesting effort because the intention here is to take Indian innovations global, right? This is a very highly selective program. A very large number of applicants was reduced down to just 15, and they have gone through a lot of preparative work to get to a point where they are actually looking at engaging with investors, with collaborators, with strategic partners, with key opinion leaders all over the world to make to take their ideas global. So this is one of its kind of accelerator, and it's done under the NIDI DST's NIDI accelerator framework, and we're delighted that BFI has joined in to actually strengthen this activity. As you can imagine, going overseas is no easy task. There's a lot of it's quite a hard job, and it is also very resource intensive. And it is actually something which we need to do, not only to show what India can do and take ideas overseas, but also please remember that today India's medicines, India's vaccines are the mainstay for the large part of the world. So I have no doubt in in imagining a future in the near future where just like we did in therapeutics and vaccines, I think medical devices will be the next space that India will have an impact. And with the emerging problems associated with sustainability, it's also very clear, and that by the way is a related problem, right? We are going to have an important role to play, especially for the global south, but for the rest of the world, which is also deeply troubled by increasing costs of healthcare and even just various other industrial activities that are happening today. So I'll stop here. Over to you, Manish, and we'll take it ahead immediately.
Thanks, Dr. Premnath. Today, we proudly introduce the 15 startups who are selected for the Leap Global Cohort, ventures who are poised to take their innovations to the international markets. Before we meet the founders, let us take a closer look at the vision behind the Leap Global program, which is supported by DST NIDI, an initiative of Department of Science and Technology, Government of India, and Blockchain for Impact, BFI, whose combined support enables Indian innovations to scale confidently into the global markets. Now, may I request the team to run the video?
Why do Indian innovations struggle to go global? It's rarely a lack of ambition or capability. More often, it is the complexities of crossing borders. Expanding beyond India means navigating unfamiliar regulations, long certification cycles, evolving customer expectations, competitive positioning, and the challenge of building credibility in new systems. For many founders, this is the most critical and most challenging phase of growth.
Recognizing this, Venture Center created Leap Global under the Department of Science and Technology's NIDI Accelerator program, designed to help high-potential startups prepare for international markets. Strategic support from Blockchain for Impact further strengthens the program, enabling global market access, strategic partnerships, and expert guidance. Leap Global is an equity-free accelerator for startups that are validated, meaningful, and ready to scale globally. Each journey begins with a focused assessment of product potential and international readiness. Founders then work through structured pathways covering market discovery, go-to-market strategy, regulatory navigation, global positioning, and partnership development. This ensures expansion is deliberate and strategically sequenced.
Startups receive one-on-one mentoring from global experts, investors, and industry leaders. Pitches are refined, strategies test-tested, and credibility built for the international audiences. Curated participation in global expos, showcases, and forums provides structured access to markets and stakeholders that are otherwise difficult to reach independently. Engagement with specialized consultants and domain experts ensures that the startups are prepared, visible, and globally competitive.
Leap Global is not simply about exposure. It is about enabling Indian innovation to step onto the world stage with clarity, capability, and confidence.
Can we pause? So today we are also pleased to announce the BFI funded Leap Partnership Catalyst Award and the Leap Global Expert Connect Award, which will further strengthen global collaborations and provide specialized expertise to the cohort. Can we run? Can we run the video? So please join your hands in congratulating the awardees of the Leap Global Partnership Catalyst Award. These are the awardees. And please also congratulate the awardees of the Leap Global Expert Connect Award. Can we hold on the video for a moment? So the Leap Global Partnership Catalyst Award, under this program, the startups will receive comprehensive support to showcase their innovations at global platforms and also connect with international stakeholders. Also, as a part of the Expert Connect Award, the startups will receive dedicated expert guidance to help them prepare for the global markets. So once again, let's applaud for all the startups for receiving this award from BFI. So now you must be excited to know what these startups work upon, what are their technologies, what is their aim to go global, okay? So let's just hear briefly from each of our cohort members. Can we run the video again?
Our scientists have identified a new pathway that leads to the triggers of autoimmunity in skin. And we have designed and developed small molecule therapeutics platform to target this path. Using this platform technology, we have identified a new chemical entity that we call AB1001 as a potential new treatment for vitiligo.
Our work is the very definition of cutting-edge system engineering and contemporary biomedical science. My team's expertise in silk protein has resulted in Telegen being the world's first company to use silk protein for bone regeneration applications in clinical studies. Our work is validated by peer-reviewed international publications and has been recognized through multiple national as well as international awards.
With this knowledge, I developed EVA scalp cooling system that helps address this specific problem. It helps reduce hair loss caused by chemotherapy. EVA scalp cooling system consists of a mobile refrigeration unit that circulates coolant through a specialized cool cap. Our EVA scalp cooling system can accommodate any head size of any patient around the world. It comes in one universal size.
Hi, my name is Ashish Kavade, and along with Aniruddha Adre, we developed the world's first triple powered defibrillator, Sanmitra series defibrillators. These work on AC mains, battery, and a hand crank generator inside. These are particularly useful during power outages.
Each blast unit upcycles 30 tons of waste daily, saves more than 700 trees monthly, and prevents 1,500 tons of CO2 emissions. Farmers' incomes rise by 40%. Crossed materials are trusted by architects, designers, and global companies, building a sustainable future.
Hi, I'm Dr. Rutul Deshpande, CEO and co-founder of Go With This. Along with my co-founders Saurabh and Nurang, we founded Go With This Mobility to redefine electric mobility through engineering innovation. At Go With This, we developed GoEVX, India's first patented range-extended electric vehicle technology. Our GoEVX system delivers consistent uptime, addressing the single biggest barrier to fleet electrification: range and reliability. One of only two partners for the Google Maps air quality project in South Asia, Respire is setting a new benchmark in how data drives clean air innovation. At Good Life Mobility, we have developed next generation non-metal Type 4 composite lightweight cylinders, which operates at 700 bar working pressure and has been validated up to 1150 bar. Our cylinders are 50% lightweight, 65% cost effective as compared to import substitutes. It can carry 2.5 times more gas because of the 700 bar working pressure, and it is dramatically safer than the conventional. I'm JD Ponni, the founder and CEO of Sensation Health Technology. Over 2 decades in the medical device development at companies like St. Jude Medical and Bosch Telehealth taught me one thing: the right tools at the right time can change everything. Our mission at Sensation is to get newborns a real fighting chance. We built Revive, the world's first fully automated servo-controlled whole-body cooling system with integrated continuous brain monitoring. Our AI-led innovations have the potential to reduce up to 16% of global industrial emissions. GreenOps, our flagship platform, is designed to impact over $1 trillion of ESG market by 2050. Our ActiveAerosol technology platform enables the user to produce membrane-bound nanoparticles, which can be specifically targeted to infect desired type of human cells and deliver RNA molecules coding up to 21 genes into the cell cytoplasm. Additionally, they are also synthesized using human cells. As a result of these two features, active aerosols can produce minimal vector virus specific immune responses which can produce toxicity.
Printed electronics know-how lets us design heaters, sensors, and circuits directly on soft substrates, a platform for many future products. We've begun with the global heated apparel market in the USA, UK, Germany, and Oceania, and will expand into applications for home and healthcare.
We designed the SSPM motor enzyme to deliver over 90% energy efficiency using 100% locally sourced components, independent of rare earth materials. It's not just efficient, it's cost-effective, repairable, and scalable. Built on a patented slip-synchronous permanent magnet design, the SSPM motor combines the best of brushless and induction systems. We are a team of engineers, clinicians, and innovators, founded by a single mission, making affordable, advanced respiratory care accessible to every patient anywhere. From Forbes India's 30 under 30 to Leaders in Innovation Fellowship by Royal Academy of Engineering, Aerobices has been recognized nationally as well as globally for advancing healthcare.
Thank you, sir. So right now we just listened to the 15 startups who are a part of Leap Global Accelerator cohort, which is supported by DST and BFI. Out of these 15 startups, 8 belong to the healthcare domain and 7 belong to the sustainability domain. All these startups are poised to make an international impact and take their technologies global. Thanks for hearing out to them. It is now time for a very special moment for all of us, that is a formal launch of the Leap Global Accelerator cohort booklet. And for the launch of this booklet, I would like to invite our esteemed dignitaries to the stage. First, I would like to invite our guest of honor for today, Dr. Ravinder Gaur, who is Scientist F from DST TTI Division, that is Technology, Translation and Innovation, Ministry of Science and Technology, Government of India. Please join our hands and keep welcoming him. So today he is here for this special moment of launching the Leap Global cohort booklet. Now may I also invite Shri Sandeep Nelwar, who is co-founder and CEO Polygon Foundation and founder BFI. Now I'd like to invite Dr. Satya Prakash Dash, who is Senior Advisor BFI and CEO IKP Knowledge Path.
Thank you for telling the BFI first.
So now I kindly invite Dr. Gaurav Singh, CEO BFI. Blockchain for Impact.
BFI is okay. BFI. You're trying to build now BFI.
Dr. Pooja Agrawal, Program Director, BFI BRI. Yeah. And Dr. Prerna Venugopalan, Founding Director, Venture Center.
Just give me the gift.
Yeah.
I'm going to only honor all of you. Thank you very much. So that's my role today.
Yes. Now I request Dr. Prerna to felicitate and welcome our guest of honor, Dr. Ravindra Gaur, Scientist F. DSc DTI, Ministry of Science and Technology, Government of India. He is our guest of honor for today. Now I also request Dr. Prerna to welcome Shri Sandeep Nerwal, Founder, Blockchain for Impact, and co-founder and CEO, Polygon Foundation. Further to this, I also request Dr. Prerna to welcome and felicitate Dr. Satya Prakash Dash, Senior Advisor, Blockchain for Impact, and CEO, ICT Knowledge Park. Now I request Dr. Prerna to welcome and felicitate Dr. Gaurav Singh, CEO, Blockchain for Impact. Now I request Shri Sandeep Nerwal, co-founder and CEO, Polygon Foundation and founder BFI, to felicitate our guest of honor, Dr. Ravindra Gaur, with a shawl. Now I request all of the dignitaries to have the Global Cohort Accelerator booklet, so for the felicitation and unveiling the cohort. So we request all of you to kindly join us in the formal launch of the League Global Cohort. So let's give a round of applause. Let's hold for some time for the photographs.
Shall we go down now?
Yeah. No, please have a seat. There is some time here. So, now I request Dr. Ravindra Gaur, today's our guest of honor, to please share his thoughts for today.
On behalf of Department of Science and Technology, I am highly thankful to the BFI dignitaries on the dais, Mr. Nehelwal and Mr. Gaurav Singh, and my colleague from IKP, who is earlier in BICAF, Dr. Satya Das, and Madam on the dais, and other dignitary of the dais. This Department of Science and Technology actually established in 1971. In our department, there are various schemes for supporting to the academicians, engineers. I think I am in IT, everybody knows. Where the student can raise their hands, they know Department of Science and Technology. Some students can raise, nobody knows. So, most of the people knows about Department of Science and Technology. There are various schemes. I joined this department in the year of 1994. I was looking after various programs. Initially, I will disclose that I was dealing with the instrumentation development program. That instrumentation development program initially in the year of 1994 supporting the development of instruments for analytical optical instrumentation, medical instrumentation, sensor instrumentation, industrial instrumentation. So most of the projects we are supporting to the IITs. Those days RECs was there, not NIT was there. Their nomenclature was changed. And we are supporting those days private engineering colleges were not also available. So we are supporting the R&D project basically. So I was dealing one PSC of sensor and light instrumentation. So we initiated a program to develop a LPG sensor those days. So we invited the proposal and our project advisory committee was telling that you seek a industrial contribution, maybe 10% of the total cost of the project. So those days in our country, the industry even was not available to support the 10% of the total cost of the project in the form of kind. So I was discussing with my boss. I was telling, sir, I could not find any industry who can support the sensor development in our country. So he was telling that we have to run our shop, so you support some project without industry also. Just take the letter from the industry in the form of kind, like they are providing some manpower support or consumable items. So time has changed a lot. Now we are seeing that program fruits are reaching, and we have a specific division in our department which was earlier known as National Entrepreneurship Board Division. Now it is Innovation, Science and Technology Entrepreneurship Division, which the technology development program which were dealing in 1994 and entrepreneurship both have been combined, and we are taking forward innovations through the startups. So these startups we are supporting in our division. In our division, there are several 6 pillars in the programs are available, like technology development program, which supports to the means R&D in the development of instrumentation or instruments. Then we start supporting the prototype development through Priyas program, which supports around 5 crore rupees for development of a prototype of a particular project. Earlier days, the scheme budget was 2 crore. Now our budget is around 150 crore or 200 crores we can support. Then we have a seed support program under which we support to the startups to the 1 crore rupees, but in the form of equity and debenture. It is not a grant actually. Then we have an accelerator program through which we have come today here, and we are now trying to take our startup to the global level. In the last December, I was in Venture Center Pune. So we were discussing with Dr. Premnath. He was telling that DST can support to the startup to go abroad. But in our department, there is no scheme available to take to the startup to the global level for commercialization purpose. I am thankful to the BFI who has come forward and supporting to the startup to take the product to the commercialization level to the global arena. I will also request to the investor, if some investors are available in the audience, and BFI also, can they support to these startup for filing the PCT applications, because they have not announced or going to support some PCT applications this startup can file in some of the country, so that our intellectual property right can be safeguarding to the other countries also. So they can sell their product into the other country and get the royalty also. Similarly, we have another program available in department for supporting to the students, like Inspire program. They support starts from 6th class onwards to it reaches to the postgraduate level or PhD level. And recently, the Prime Minister has announced a program of research development innovation program RDI scheme, which is a 1 lakh crore scheme for 5 years, under which the second level fund manager will come into the picture, because we cannot provide the grant in aid to the industry. So under this scheme, 50% amount has to be invested by the industry. Government will provide on the cheaper basis loan up to the 15 years duration, long-term duration, the 15% cost has to be provided by the government in the form of loan, and 50% the industry will be investing for developing a product or prototype or technology or whatsoever is there for developing instrument, take it to the commercialization level at the global level. And this grant has to be decided case to case basis. It is not a simple grant that you are coming and they are giving the grant. Everything has to be discussed so that product should go to the market level. Similarly, there are other schemes in our department. There are missions program, supercomputing mission program, and we have a program on semiconductor missions. So DST is also involved in semiconductor mission program. There is a new program has been launched by the department, that is quantum computing program. This quantum computing, because we are starting in quantum computing, so there are 4 pillars in the program in quantum computing, that is quantum materials, quantum communication, and quantum computing. So there are 4 pillars. So you can submit the project into the quantum communication or quantum materials, quantum computing, quantum communication, and similarly other programs are supercomputing mission program in our department. And this NEB division is supporting some other program like training program also. This small level program for grassroots innovators, that is WEDP, Women Entrepreneurship Development Program, Faculty Development Program, and Faculty Entrepreneurship Development Program, so that faculty can teach to the faculty for go for entrepreneurship. Because in academics, this is not a major field for doing the entrepreneurship work or doing innovations or doing research and development project. So with this, I will not take more time. And our website is dst.gov.in, and our specific division website is also available, nidhi.dst.gov.in. Thank you very much for listening to this presentation.
Thank you very much, Dr. Gaur, for sharing your thoughts today. Now I request all the dignitaries to, and first of all, I thank them for being here and for formally launching the booklet. Now I request them to please be seated. Thank you for joining. Thank you so much. Now I request Dr. Premnath to please share his closing remarks.
I can see Sanchita getting nervous. So, well, first of all, I just have to make a few comments, which is very important. First of all, I want people here to understand that the pioneering work that DST has done in India. 40 years plus back, they were thinking about incubation and science and technology based entrepreneurship. And the first science and technology parks were started way then, right? And it's amazing that they could do all of that. Following that, there have been many efforts to do a variety of things, but around 2015-16, the Nidhi program was started, which is an umbrella program covering multiple aspects of entrepreneurship and science-based innovation. And Dr. Gaur here leads the activity for the Nidhi accelerators, which are focused on certain themes, like ours is focused on Leap Global, which is going global essentially, right? And it's really impressive, in my opinion, that young India, represented by Sandeep and Gaurav, are today, backing such ideas and creating that energy and effort needed to take it all the way, and really, make a mark for India. I think that's quite important, and this is an occasion to celebrate. And I should, and that was one of the reasons why we thought this was the right place to showcase some of our startups out here. As you might have noticed, all the Leap Global cohort startups are very impressive startups. I mean, they are people who are doing first of its kind of work, and they will definitely make a mark. Of course, the journey is very difficult, and that's what we are here to help them, traverse. And in this journey, I thank BFI for joining us and giving us that extra bit of energy and support to take it all the way and to raise the bar for many of our startups, allow them to do something a little more ambitious, which they normally cannot do if they were restricted by or limited by resources. So thank you once again to Sandeep and Gaurav for their leadership and for making all this possible. So with that, I'll close. Thank you very much. Sanchita, floor is yours. Thank you.
Thank you, Dr. Premnath. As you rightly said, this is an occasion of celebration. We are going to continue the celebration by the next session, which has a battery of distinguished guests here joining us on stage. To start with, it is BFI Innovation Full Stack launch. I would request Dr. Gaurav Singh, CEO BFI, to kindly come up on stage and give a welcome address and set the context.
Respected officials from DST, respected directors of various prominent institutes present here, respected students. Also, I may also want to welcome people from public health space and also our companions from the pharma industry, from the medtech industry. A very warm welcome to all of you and thanks for being here. आज जैसे अक्षय तृतीया पे बहुत सारी शादियाँ होती हैं, बाई चांस आज बहुत सारे इवेंट्स हो रहे हैं हर जगह पे. So I am sorry to take your time, but thank you for coming here. We are highly obliged. Just to reflect 2 minutes on BFI journey, we are an emotional organization because our starting was based on a simple emotion of empathy that our founder believed that during this second wave of COVID, we were supposed to actually help out India in the best possible way we can. When we started the journey, it was mostly relief work, but after that journey, we came to realize that things need to change. The major realizations was that although many institutes are working and doing very good work, but most of them are working in silos. The second major realization was that we are a product import nation. We are heavily dependent on other countries for our basic supplies like ventilators and oxygen cylinders. And that was a very sad part at that time. And lastly, there is an absence of risk capital in our country. Government funded projects mostly are bound to succeed because you cannot submit a negative report at all. So here we thought that we can make a difference and we can make some changes. And then we started our first program, that is the BFI Biome program. So now when we talk about the healthcare pillars, we think that there are 5 pillars in healthcare. One of the pillar is, of course, the research institutes. The second one is the incubators, medical incubators. Third one is the medical colleges. And fourth one is the public health organizations. And lastly, the fifth one is the industry, which manufactures and does the marketing of the products. Now, our vision was how can we affect each and every sector to actually make an impact. So first of all, can you change the slide? So the first program we launched was BFI Biome, in which we were supporting some research institutes with $1 million funding for running out various projects there. And currently we have 11 research institutes as our partner organizations, including 4 CSR institutes, 2 IITs, CCMB, CDRI, and FNDR, TCG Crest spread across India. And with that, we currently are supporting 200 plus scientists with 45 projects. The second program that we run is called the incubation program, in which we are supporting 7 incubators across country. The CEOs of few are there here already. So we are supporting organizations like Venture Center, IKP, SIIC, IIT Kanpur, FIIT, IIT Delhi. Dr. Nikhil is not there, but we are supporting many incubators since last 2 years with fellowships and Kickstarter grants. Then 1 year back, we came up with a program called Samarth and Medical INI, in which we are initiating research projects in medical colleges. And we are proudly partnered with the 20 plus medical colleges across India. And out of those 20 medical colleges, AIIMS, Delhi AIIMS, Jodhpur, AIIMS Bhatinda, and then we have SGPGI, we have PGI Chandigarh. So all the prominent medical colleges, including CMC of Los Angeles, are with us now. Similarly, on the public health part, we have started a program 2 years back called District Full Stack, in which we are covering 10 districts of India, and where we are placing our fellows that are interacting with the CMOs, the district magistrates, the local health officials to understand actually what the problem is, and then finding a scientific solution to that problem. And lastly, one thing that we'll very soon start is how we can also affect the market access. So with this, I introduce the main pillars of our program. Next. So the first program that we are launching under Innovation Full Stack is called NAMA, that is Narwhal MedTech Accreditation Center. And special thanks to IIT Delhi, special thanks to Dr. Ravi, and special thanks to Dr. Dinesh that we are partnering with IIT Delhi for their prototyping facility, and all the innovators across India can use this facility for making their products and prototypes, along with the regulatory support that we will provide. Under NAMA, we also have our partner, the Regional Center for Biotechnology, RCB Biocluster at Faridabad, which will take care of all the wetland-related innovations. Also, we are partnering with Venture Center and IKP to have a separate hub of prototyping and innovation in Pune and Hyderabad. Now, the second program that we have launched in the Innovation Full Stack is called MedTech Incubation Program. So we put out an open call in which all medical colleges can apply to us for opening an incubation center in their medical colleges. And we happily received around 30 plus applications, out of which 10 were selected, and all of them are there in this room, and we'll announce one by one. I think Dr. Shweta will take this opportunity. Lastly, we will have a district sandbox program in 10 districts of India, where we will be providing the innovators CDSO approved instruments, CDSO approved startup related things to the CSCs, PSCs and district hospitals for validation and for whatever inputs come from the public health side. And lastly, we have a product promotion team. This is a very unique thing that we are starting, because what we believe is that many innovators are very good at innovation but are not that good at selling. So we are making a team of 25 people based in 10 cities, metro cities, where they will do just one thing: take the product to the last buyer, that is the clinicians, the doctors and the public. So what we think is, if they have the capability, if they have the resources, they can definitely help sell the product in the market itself. Next. So I'll just say how all this thing is. This experiment of ours is that this basic research is now successful. The second idea can come from the medical college itself. A doctor during its rounds finds there is a problem. A doctor thinks that, okay, this product is needed in the hospital, and they can then produce that idea. The idea can come from the districts, where the doctors working at PSC, CSCs, where Anganwadi and Asha workers can contribute to that idea, that, okay, this is a problem that needs to be solved. And lastly, idea can even come from the product promotion team, where they say that while we are marketing these things, all these products are Western products, all these products are imported, there is nothing in India like this. So that idea then goes to our prototyping facilities, that is under NAMA, that is the M Pragati, that is the RCB, there's a venture center related facilities and IKP related facilities, where it will be converted into a prototype. A very important thing to note in this process is that every product that comes into the ideation phase will be validated by the medical college team and the product promotion team. So if the doctor says this product cannot be sold, that idea will not be taken forward. But if he says that this is a very good idea, we will definitely take it forward. If the product promotion team says that, okay, you can build this idea, but we cannot sell it, then it stops there only. So after this prototyping, that prototype then goes back to the medical colleges for testing and validation. The sites that we have now, we have 10 sites, then we are signing LOIs today, and few of them have converted into MOUs also. After the finished product, that finished product goes to district sandbox and medical colleges for final validation, and then is finally handed over to product promotion team. So the final thing in this is, whether you are at TRL 1, 2 or you are at TRL 8, you can enter this flowchart into various spaces. We can start product promotion with already prepared product, or we can start the ideation phase with the research student itself. With this, I stop, and this is the innovation full stack that we are presenting to India, and thanks to my founder and his benevolence that we are today here for the inauguration of innovation full stack. Thank you. I welcome Sanchita sir to ma'am to actually invite all the LOIs and MOUs on this stage. Thank you. I'll be with you. Okay. मैं सबको बुला के स्टेज पे लॉन्च कर दीजिए. सबको बुला लीजिए.
So it's now my privilege to invite on stage the dignitaries from the various 15 plus partner organizations who are joining hands with BFI for Innovation Full Stack. To start with, I would like to call upon stage Professor Ashwini Agarwal, Dean R&D, IIT Delhi. MOU exchange.
Thank you for taking your time out, sir.
Of IIT Delhi with BFI. I request Dr. Dinesh Kalyan Sundaram and Dr. Ravi Krishna Ganguvan, the PIs for the project from IIT Delhi, to also join on stage. Mr. Sandeep Narwal, please request you to join on stage.
So, just to add, we met Dr. Ravi and Dr. Dinesh 3 months back only, and it is one of the fastest signing that we have seen with IIT ecosystem. Thank you, sir, for this. Thank you, sir. Yeah, please. This is yours. Thanks.
Sir, requested to be here 5 more minutes for the I now invite on stage the professors, Professor Deepthi Nair and Professor Sachin Kolte from Vardhaman Mahavir Medical College and Safdarjung Hospital. The principal, Dr. Geetika Khanna, is stuck due to a ministerial visit. So on behalf of Safdarjung, they will exchange the LOI with BFI. I request Mr. Sandeep Nairwal and Dr. Gaurav Sukh to kindly exchange the LOI. I would like to now call upon Dr. Sudeep Bhar, Controller of Administration, Regional Center for Biotechnology, NCR Biotech Cluster. Request Ms. Suman Gupta, COO, Bionest Bioincubator, to also join on stage for the LOI exchange. The LOI will be exchanged between BFI and RCB for the NAMA program. The next LOI exchange is with Venture Center, Pune. May I request Dr. Premnath, Director Venture Center, to join on stage. With him is one of the clinical partners already onboarded with Venture Center. May I request Mr. Ritesh Deshpande, General Manager, KLE Academy of Medical.
नहीं आप ही के लिए है मेरा हो चुका
आइए सर
रितेश आइए आप भी आ जाइए आप भी आ जाइए रितेश यू कैन जॉइन थैंक यू
The next LOI signing is with IKP Knowledge Park. May I request Dr. Satya Prakash Das, CEO, and Dr. Tony Raj from St. John's Hospital as the partner, as the clinical partner, to join us on stage. While with IKP we are exchanging the LOI For NAMA program,
Thank you.
Thank you.
Just let me say that right now on this stage, Dr. Tony Raj and we agreed, IKP agreed to be working together. So this is another LOI that's already happened.
may I request now Dr. Anubhav Gupta, Associate Professor from AIMS Jodhpur, to kindly come up on stage. Dr. Govardhan Dutt Puri, Executive Director, could not make it. On behalf of the Executive Director, Dr. Anubhav Gupta will exchange the LOI, the AIMS Jodhpur and BFI. AIMS Patna, may I request Dr. Sanjay Pandey, Dean Research, to kindly join on stage. May I request Dr. Sudeep Kumar, Professor, Department of Orthopedics, Dr. Moushami Shaha, CEO, AIMS Patna, Incubation and Innovation Council, to also join on stage.
He is the real person. Thank you so much.
Thank you. Thank you.
BFI is signing an MOU with JIMS, Noida Government Institute of Medical Sciences, Greater Noida. May I request Dr. Brigadier R.K. Gupta, Director, JIMS, Noida, and Dr. Rahul Raj, CEO of Center for Medical Innovation, to kindly join on stage.
आइए सर, मित्तल सर, आप भी आ जाइए कोई.
I request Sanjeev Mittal sir, mentor to BFI and many other institutions, a former bureaucrat, to also join us on stage.
Thank you for remaining back, sir.
राहुल राहुल से
How, sir?
राहुल से इधर आ जाओ तुम you come here.
Dr. Rahul, you are invited on stage, please.
He is very good, sir. Because of him only I am able to, I can say proudly, yeah. Thank you so much, sir. Thank you, sir. Thank you.
Thanks to Rahul and his intent, the MOU was signed in one day. I went there, and in the evening we had that. Thank you, sir.
I now request Dr. Tony Raj, Dean, St. John's Research Institute, to come up on the stage again. This is an LOI with St. John's Medical College.
Thank you so much.
So you'll take this?
I now invite, it's my privilege to invite Dr. Balveer Singh Tomar, Chancellor, NIMS Jaipur, to kindly come up on the stage. Thank you so much for making it today, sir. I request Dr. Sanjay Patan Shetty, Professor and Director, NIMS, also to join up on stage.
It's a privilege to stand with sir because we have read his books, we have learned his stories since long, and he's like a mentor to me. Thank you, sir. Thank you for coming.
Please go.
इधर आ जाइए, बस इधर आ जाइए. Thanks a lot, sir.
Thank you very much.
Thank you, sir.
Thank you so much. And great. Thank you so much for everything you're doing. Thank you very much. Thank you very much.
Thank you so much, sir.
Thank you, sir.
I now invite Dr. Gitanjali Batmanavare, Pro Vice Chancellor, Geetam Vishakhapatnam. Request Dr. Hyanvi Balla, Assistant Professor, Oral Pathology and Microbiology, to also join on stage. for the LOI exchange.
Thank you, ma'am.
Let her write the time. Thank you so much.
Thank you, ma'am. Just to mention, among all presentation, Geetam was the best, so we could not actually let you go at all.
Thank you so much.
I now invite Dr. Arjun Agarwal, Director, Bareilly International University, Rohilkhand Medical College, on stage. I also request Mr. Claudius Lazarius, CEO of Bareilly MedTech Incubation and Innovation Labs, to join on stage for the LOI exchange.
The idea of MedTech Incubation Center came from Dr. Arjun only when he approached me that he wanted a medical college and having an incubator. Would you like to speak something?
I just want to thank BFI, especially Dr. Gaurav, because being a part of a medical university, we always had ideas, we had some visions that yes, healthcare is not just about treating patients, but to make new researches. So we wanted to take those steps, but we didn't know how to take. So thank you BFI and Dr. Gaurav especially to help us take those steps, and hopefully in near future we'll be one of the best incubation centers in the Rohilkhand region. Thank you.
Our vision of reaching Tier 2 and Tier 3 cities is completed with Dr. Arjun and KD Medical College. Yeah.
Next, coming up next, Dr. R.K. Ashokardeen, KD Medical College, Mathura. May I request you to kindly come up on the stage, sir.
Done last time? धन्यवाद सर आने के लिए. इसको ले जाइए.
Dr. Gaurav,
ये नहीं चल रहा है सर.
Dr. Gaurav is a very dynamic professor and faculty in our medical college, that is the KD Medical College, and he's very social also. All the programs in the district level, the DM or the SSP or the jail superintendent, whenever they call for the medical help, he's available already all the time. So I'm very much having this proud having this type of faculty, and also proud having this being involved in this innovative programs. Thank you very much, and Dr. Gaurav, I'm proud of you.
Thank you.
We have two more MOUs.
बीच में है.
We have two more MOUs to be exchanged. One is for the product promotion vertical that you saw on the Innovation Full Stack. May I request Mr. Ashish Dhardwedi, Managing Trustee, Helping Soul Foundation, to kindly come up on stage. So Helping Soul Foundation is partnering with BFI for product promotion segment of the Innovation Full Stack. It's a privilege to request Mr. Jagdish Pai, Senior Advisor, Bharatiya Vikas Trust, to kindly come up on stage. This is an addendum MOU signing for the BFI Sandbox and Interconnect Fellowship Program.
Through BVT, BFI will be offering 200 fellowships in next 3 years, and each fellowship will be 1 lakh per month for innovators only. Yeah.
Now I would like to formally request Mr. Sandeep Nailwal, Dr. Gaurav Singh, and Professor Ashwini Agarwal to formally launch the Innovation Full Stack, and with him I would request all the dignitaries, heads of the institutions who have signed LOIs with us to join us on stage. I would announce their names, please. Dr. Sudeep Bhar, Controller of Administration, RCB, request you to come up on stage once again, please. Dr. Premnath, Director, Venture Center. Dr. Satya Prakash Das, CEO, IKP. Dr. Sanjay Pandey, Dean Research, AIMS Patna. Dr. Brigadier R.K. Gupta, Director, GIMS Noida. Dr. Tony Raj, St. John's Medical College, sorry for calling you on stage for the 3rd time. May I also request Dr. Arul Selvi, Subramaniam, HOD Division of Trauma Lab Medicine, AIMS Delhi, to join us. They may soon join us for the program. We are in active discussions with AIMS Delhi. May I request Dr. Balveer Singh Tomar, Chancellor, NIMS Jaipur, once more. I think he's left us now. Dr. Gitanjali, may we have you on stage once more?
Probably need to. We can fit. Yeah, we'll have to all
Dr.
take
Arjun
a deep
Agarwal,
breath. Yeah.
Director, Bareilly International University, Rohilkhand Medical College. Dr. Ashoka, Dean, KD Medical College. Mr. Jagdish Pai, BVT. And Mr. Ashish Dhardwedi, Helping Soul. May I also request Dr. Beeta and Dr. Jyoti, scientist C from ICMR, who have joined us for the event, to join us on stage. Dr. Taruna Madan Gupta is expected anytime soon from ICMR. She heads the development division. But I would request Dr. Jyoti and Dr. Beeta to join us on stage.
Mr. Edward also, MD, BFI.
May I request Mr. Edward, MD, BFI, to also join on stage? Edward, I can't see you. Okay.
बस नहीं तो मैम आगे आप आ जाइए मैम, हम लोग तो पीछे will be visible.
Ms. Suban Gupta, we can have you on stage as well, please. Thank you. Along with the photo op, I request the dignitaries to kindly click the button and officially launch the Innovation Full Stack also.
अब आगे 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 थोड़ा सा आगे बस बस.
Just a minute. Let us practice a little.
Yeah.
All these things need training, right?
Address of director, deputy director, address of deputy director.
May I now request Professor Ashwini Agarwal, Dean R&D, IIT Delhi, to address the audience.
So good afternoon to all of you, and thank you for coming and joining hands with each other. It's a very special occasion. I'm delighted to see such a esteemed gathering here at IIT Delhi. We are very privileged to have you here. I must say we need some kind of a magnet to bring people together, right? And BFI has become that magnet today. So yes, it's a initiative which has been taken by BFI. I know when I first met the team from BFI, we were not very clear about what the idea was, but I think soon it became quite clear how things have to proceed. There have been a lot of questions during this journey because we have not done something like this up till now, right? We are doing something at this scale for the first time at IIT Delhi. I know Professor Dinesh and Professor Ravi, how much work they have put in to make an ICMR center here, which is for translational research, the kind of efforts they have put in to bring it to this level. And then to take it forward, BFI has come forward to see whether this fruit can actually be taken up and shared with other institutions of repute, which I'm seeing. I'm very happy that so many of us are here today. it is important. I mean, we do all fundamental kind of research. It's very important to see translational work, and something like this is required. And money is one thing which is of utmost importance because these things are really expensive. To take a technology, especially in medtech area, from lab to market is a long journey and a very expensive journey with involvement of a lot of professionals, not only the researchers but also the technicians, clinicians, and marketing people. So bringing all of them together on one portal is a job which is well done. I hope BFI succeeds in it and expands this program further. My congratulations and my best wishes to all of you, and we'll be more than happy to associate all of your institutions to do even the fundamental research. Let me tell you, IIT Delhi and other IITs, they often have thought of after the NEP new education policy was launched, that all institutions can become multi-speciality institutions, right? So IITs have been trying to see whether we can have their own medical college. But more and more, we have realized that we have so many good medical colleges already. There's no point of creating one more where we are not good at. When we are being a technical institution, not good at running a medical college or a medical institution, it is better to collaborate. And we have so many good ones in Delhi itself and then around Delhi and in the country. So I'm very, very hopeful that this association of bringing us together will be very fruitful for this country. And I would like to see technologies coming out and being launched in the market. Let's hope that one day we will be known for this kind of a collaboration and this kind of effort. Thank you again for DST, for BFI, and all other institutions who are here. Thank you so much.
Thank you so much, sir, for your address. It is now my pleasant responsibility to introduce the Namaha component of the Innovation Full Stack. Dr. Gaurav Singh has already given an overview, so I will not dwell too much upon it. Just briefly tell you the model that we propose to work with, and we have initiated the partnerships. You saw the LOI exchanges today. Can we move to the next slide, please? I will not go into the challenges. I think they have been discussed since morning through different panels as well. Next one, please. So this is to show where we stand. The NAMA, the green boxes you see in the Innovation Full Stack is where the NAMA stands. So you see between the ideation and the finished product, the entire acceleration will be done through the NAMA vertical of the Innovation Full Stack, through the different partner institutions, clinical partners, and other knowledge partners which we may plan to take on board in due course of time. So essentially the ethos of NAMA is to anchor expeditious translation of medical technologies through ecosystem partners. All ecosystem partners are existing, innovation exists. It's just that somebody mentioned in the previous sessions also that everybody is working in their own niche areas, and because there is no crosstalk or very limited crosstalk, innovators fail to move from one to the other depending on where they are able to find the actual expertise. So we are going to bring together this expertise on one platform through Namaha and bring innovators on board, curate it through a curated process, and then do the matchmaking so that they spend the minimal time they need to take from lab to market, from prototype to market. So it's a unified hub and spoke acceleration system that we are talking about for innovators, integrating all stakeholders in a single execution framework. When we are saying stakeholders, it includes innovators, expertise in terms of research institutions through technical expertise, infrastructure support, mentorship, regulatory expertise and compliance facilitation, and then feed into the next verticals of the Innovation Full Stack. The mission, as I mentioned, is to fast-track transition of indigenous high-priority medical technologies and bridge the gap between the initial prototype and reach to the consumers. So as mentioned, the first hub and spoke model in the NCR region or the northern part of India, we have IIT Delhi, the M Pragati facility supported by ICMR DHR at the center, at the core of it, and Regional Center for Biotechnology in the NCR Biotech cluster. While IIT Delhi brings the medical device prototyping, ISO compliance, and many other expertise which you all were privy to during the visit before lunch. RCB brings in animal facility, BSL labs, and other expertise in terms of infrastructure, incubation on board. And the spokes that you see are clinical partners. Here we already executed LOIs with or MOUs with most of them. We are in discussions for execution with AIIMS Delhi here. So we have NIMS Jaipur, Bareilly International University, GIMS Greater Noida, Safdarjung Hospital, Vardhan Mahavir Medical College, and KD Medical College that we are already started working with. The other two hubs and spoke models that we plan to work with, one is in the western region with Venture Center, and you see the clinical partners of Venture Center, and we will add more as we move forward and sign LOIs and MOIs depending on the need and expertise requirement. The one in the south is IKP Knowledge Park, both in Hyderabad and Bangalore now, and we would also work with the clinical partners as you see with them. So essentially, we are looking at complementary expertise and experiences bringing together so that an innovator working in medtech innovation, the moment he comes into our ecosystem, we know how to match make and where to match make. And even the innovators are comfortable because they know what they're looking at. And their roadmap is built right at the beginning of their onboarding into the ecosystem. So I'm not going into the details of what every organization brings. It's right up here. Essentially, from Namaha, it is fed into clinical validation and market access, which is going to be taken over by two of my other colleagues. So I leave the ground for Dr. Shweta Jindal to kindly come up and talk about the pillar of medtech innovation in medical colleges.
Hi, good afternoon, everyone. I hope we are still awake. I know there's been a lot of room in the action, and I'm just going to take you through the next step of this program, the wonderful full stack that Dr. Gaurav just spoke about. And the first step you've already heard from my colleague, Dr. Sanchita. So moving on to the next step is clinical validation and market access, as Dr. Sanchita shared. And this is medtech incubation. So we move on to the next steps, which are a collaboration between incubators, innovators, and enabling the commercial access of these products to the market. So the vision of this program essentially is to bridge the gap between medical innovation and clinical practitioners, because essentially that's the problem statement we came across, that innovators do not have an access to clinical environment and vice versa. Therefore, this element of the program was developed to provide direct access to clinical and patient environment to the innovators, get mentorship from medical experts, and guidance through ethical and regulatory approach which exists at most of these institutions. These are the 4 objectives that we set out to achieve under the MedTech Incubation Program, which is to foster a culture of collaboration between innovators and clinicians and also researchers, provide infrastructure, more importantly, to all the startups and innovators that they really need during their stage of prototyping and validation, to support the innovators with mentorship, infrastructure, and the kind of guidance that they need in that process, and to accelerate the commercialization of their products, as you just heard. Now, how do we do this? This is the theory of change of the MedTech Incubation Program. Through the inputs like enrollment of medical institutions as incubators for the MedTech Incubation Program, we help them provide with infrastructure and human resources for this program. The infrastructure that is to be earmarked is typically 3,000 square feet of area and dedicated working spaces for the innovators at each of these institutions. And identification and shortlisting of these institutions has already been carried out, whom you just saw at this stage a while ago. The outputs that we intend to achieve are an enabling environment for innovators for clinical validation and evidence generation on their products, getting support with mentorship, ethical clearance, and other regulatory compliances. And lastly, but more importantly, a collaboration between innovators, academic institutions, policy, and program partners. At the end of this process, what we aim to achieve as outcomes are promotion of a culture of research and innovation across medical institutions, enabling cross-pollination of ideas and collaborations among innovators, clinicians, and researchers. I have to highlight here that this is a first of its kind program in India where each idea and each innovation should or would have undergone review from 25 plus clinicians across the country through all our partner institutions that work with us. And lastly, acceleration and scale up of these innovations across the environment through all of the steps of the Innovation Full Stack program. This is the key process which will take place across all of the 25 partner institutions. The problem statement around healthcare needs would be generated through medical institutions and other partners, as was shared by Dr. Gaurav a while ago. The ideas and the prototypes will then invite reviews from all the medical specialists that are present across all our partner institutions across the country. These ideas and problem statement, once validated by this team of experts, can undergo the prototype development and finally lead to product incubation and validation across these institutions who are a partner of our MedTech incubation program. This is the list of the institutes. You've already seen the faces a while ago, and this is the list of them officially. We've exchanged the letters of intent and MOUs with all of these institutions. They're on the screen for all of you to see. So this is a little bit in brief about the MedTech incubation program. I'll pass on to the baton to my next colleague, Naga, for District Full Stack program. Thank you very much.
Hi, good evening. I also promised to keep this short. I think Dr. Tony and a couple of others were talking about the context part of how do we bring problem statements from the ground up, match that to innovation. And I think that's kind of what this vertical does. What we really believe is that whether it's a public health process, any kind of technology, medtech included, ultimately it has to work for people. And people are sort of governed by policies and they operate within markets. A lot of times what we see is we're trying to operate in a place where both policy and markets have failed, and which is why we see that maybe we keep getting things wrong, where innovation is happening very disconnected from what the needs on the ground are. You see that solutions are maybe being pushed down on people at multiple layers in the system, but then adoption becomes very difficult. But it's also true the other way around. So we feel that that's where an organization like BFI and philanthropy can play a role. I think catalytic has already been covered, but I think one other thing that we do is to sort of try and de-risk investments. So de-risk investments that can go into policy experimentation, which is something that the government, being very large, can actually cannot do. I think what governments can do is try and create an enabling environment, but it's younger, smaller organizations like us, individual startups, entrepreneurs, civil society organizations, who are actually agile and nimble. We can really get very, very close to the problem statement and start to design from there. So I think this is how we kind of see our strength and the government strength at scale sort of working together, and we kind of work at the intersection of this. What this sort of looks like is we try and embed teams that we call the learning layer close to where the problems are at the district level. The idea is to sort of try and get a seat at the policy table right from the district and lower all the way to the state. Uh, it also helps with health being a state subject matter that we're able to actually have a couple of these conversations and see how we can institutionalize this into policy design. So I think design thinking is required, of course, in the innovation space. I think it's also somewhere required in terms of how policies are designed, and not only and also in how innovations are taken to the ground. So we sort of try and look at a lot of these things, and until we actually experiment on the ground, we're not going to get closer to solving the problem. So that's essentially what we do with the first vertical, which we call the IHCRF program, where we're trying to build, trying to embed ourselves within the public ecosystem and try and really understand what the needs on the ground are, and try and then bring it into the innovation and the academic ecosystem. Recently, I kind of so these are some of the districts and regions where we're working. We've been working for about a year and a half now. FIA is a ground partner who's actually helping us operationalize this on the ground. So what this looks like is it looks like a lot of conversations that are happening to really work with and understand the problem from the people who are facing it, from the people who are trying to sort of solve it at the front line. A lot of conversations, design workshops, digging really deep into trying to understand why are things actually failing or why are things not working. So one of the somebody was speaking about a cross-disciplinary, multidisciplinary team. I think that's kind of how we structure. In fact, I think the whole of BFI, you'd find doctors, engineers, legal folks, everyone trying to look at the problem. Fellows are our closest sort of pieces of infrastructure close to the problem. I think I missed this slide. Now, I also read somewhere that design fails when it replaces what it does not understand. And I think that's extremely true to how innovations are designed. If innovations don't solve for the end user, don't solve for the market, don't understand the system, then it's kind of extremely difficult for it to actually diffuse into the system. And we've seen this with multiple iterations. We've done pilots for a long time now, and a lot of these pilots don't scale because we are actually not designing it for scale. So this is where the sandbox program comes in with BBT as a partner, where through fellowships and funding innovations which are ready to go to market, we trying to de-risk that pathway, sort of try and take them through to the public system, to the public health system in that sense, try and de-risk the conversations that they can have at the district level and actually show the impact that the technology can. A lot of it would be, I think, learning from failures, understanding why things didn't work, and then going back with a slightly changed solution in order to solve for it. So the value of death, as it's sort of popularly called, also sort of overlaps with what this pathway is like. So lab to market, lab to policy. I think these are all very complex pathways, and every technology ends up taking its own path. And essentially what we want to do is walk that path along with people who are designing these solutions by bringing the voice of the people who will eventually use it and the people who will eventually pay for it, which is the public or the private system. So yes, so I think that's essentially what we're trying to do. 10 sites which will act as a test bed across the next few years, where we'll try and take innovations, so try and figure out how things work with the government. What does procurement look like? What does evidence for the government look like? Is it a clinical pathway? Is it at the primary, the secondary, the tertiary level? Does it look different at different levels? Those are some of the questions that we're sort of trying to ask ourselves and find the answers to. Yeah, broadly, these are some of the parameters that we look at for every piece of technology or process that that comes to our ecosystem, and we try and help and find its path to the ground. Yes, I can maybe pass it on to the next vertical.
Thank you. How do I put it? Okay.
so much, Naga. We are just taking up the last part of this innovation full stack. Good afternoon, everyone. Yeah. First of all, I'd like to thank BFI, especially Dr. Gaurav, Sandeep, for partnering with HS Foundation to take up this enormous challenge, a very ambitious challenge that we are talking about. That is the product promotion program. In our multiple engagements with many stakeholders all across the ecosystem, be it the startups, the incubators, industry, academia, all across, there was this singular pain point that has been resonating with everybody, and that is that once a product has been made, the market access is a very big problem to be solved. It is one of the most stumbling blocks for almost all the startups, and this problem is what we are going to take up, which we are trying to solve. Yeah, I'll just move. So the product promotion program that we are going to launch as a part of the Innovation Full Stack, that is, we are going to enable the market access for the startups, and not only enable but also handhold them through all the stages that takes them to the market access part. So moving forward, so what is the problem? The problem is that many of the medtech and biotech startups have a lot of difficulty in accessing the market. First of all, many of them, after having made the product, after having all the regulatory requirements in place, still they do not know where to begin, where to start. So that part is another challenge. Next, we have that the startups do not have an innate understanding for the requirements that is expected from the industry. So there's a limited understanding of the market needs and pricing. So that is another, we are trying to give a feedback loop to the startup so that they'll be able to develop on that part. Then there is a trust deficit in the doctors about trying the new startup products. Many of them are very much comfortable with trying the tested, the G's and the Siemens of the world, but they are very reluctant to try the new startup products. That is another point that we are trying to take up. And then there is an acute shortage of distribution networks. Many of the existing distribution partners do not take up the startup products and take up the distribution for them. Then there is an opaque and complex procurement and tender process, not only in the government sectors, but even in private hospitals and other clinicians. They have a tough time navigating that part, because many a times there's a huge maze of purchase managers. There are a lot of people whom they have to get in touch with. So that is another roadblock. As a result, we have promising innovations who could very well be a part of the ecosystem, very well be a part of the hospital networks of the clinicians. They get left out. That is a very big problem that we are trying to solve. Moving ahead, so this is our solution. That is the go-to-market strategy for startups. So this is where we are introducing the product promotion program, a complete end-to-end market enablement program for the startups. And through this program, we are trying to solve this very big Gordian knot that is hampering the startups from reaching its full potential. Now I'd like to invite my colleague from HS Foundation, Mr. Satyavir Yadav. He has deep expertise in medtech marketing ecosystem, and he will then take you forward in this journey. Thank you very much. Please. Yeah.
Thank you, Ashish ji, and good afternoon, everyone. Please excuse me if I miss anything, because I'm technically just 3 days old into the system, and BFI is doing so much. I'm trying to learn and remember everything, so please excuse me if I miss anything. Just to start with where Ashish ji left. So what we are doing, what we are trying to do here is we have 5-step program in this, this as a 5 steps. So we start with the most important thing, which is a early market access, because what happens is many times people don't know they have made the product, but is it a market fit? So what we exactly do is we assess their innovations at a very early stage to find out a market fit, sellability, and even the commercial viability of that particular product into this, and taking the feedback back to the innovators to tell them maybe this is lacking, maybe this can be improved, or maybe improved further. Now the second part comes here is the category and the market creation, because many of the innovations, I remember I have seen a innovation which was something which is very different, but the market is not accepting it because it was challenging a very core thing what was actually people were using. So what happens is sometimes there is a possibility or a need for that market creation or the category creation, where we do the positioning for the product, we do the identify the right segments for that product, or maybe sometimes the right positioning and place for that particular product into the market. Coming to the third point, I think, which is again an important point and a pain point of many of the I'll say startups, because they know the product, they know how to do that, they know how to create a new product, but they don't know how to go to the market. And that's where I think the third steps comes into picture, that how we take that product, how we do the outreach, how we build the product promotion for that particular product. And that's where we engage clinicians through the demos, through the awareness and the adoption initiatives for that particular product. Then comes the next part, the distribution, because this is again a very important thing, because many times people have the product, but then there are so many distribution channels available in the market, they don't know which one to pick. That is where again the fourth step we will come into the picture. We will help them with ensuring finding the right distribution channel for them, and also finding the right distribution partners into the market so that we can make the product available to the end customer. And the last step is obviously the private and the tender business development, because this is where I think you have the product, you have everything, and then last thing that everybody is looking is for the generating the revenues. And this is where it comes into the picture, that we will help them to the right entry, supporting the right entry into the private markets, obviously, and also government procurement plans and different programs, that how we can enter there and we can sell our product. Now coming to the next, and this is what our plan is right now, that we are looking at having 40 team members across India in 12 major cities. And in the next 2 years, we are looking at around having 20 different innovations on board that we will take it to the market and support those 20 innovations. Now, when we are looking this, obviously, I'm sure with all the steps and all the I'll say experience that we have, the BFI and from the HS Foundation, I'm sure this is the impact that we are going to support all the startups or these innovators is faster commercialization, increased product uptake, sustainable revenue pathways for them. And obviously, I think all this is for sure is help us to have a scalable healthcare within India and maybe world over. So with this, I think I'll take you to the more of a curtain raiser for our initiative here.
Ready with rigorous research, ready with clinical validation, ready with regulatory strength. Across laboratories, institutions, and startups, breakthrough solutions already exist. But belief alone does not transform healthcare. Across the nation, medical technologies are gaining momentum. Innovations are being developed. Patents are being secured. Approvals are being earned. Yet momentum without direction cannot create systemic impact. When access is created, belief finds reach. When access is enabled, momentum finds direction. When access expands, research moves beyond laboratories into hospitals, doctors, and patients. And what was ready becomes available. When belief, momentum, and access come together, innovation ascends, from research to reach, from validation to adoption, from breakthrough to bedside. Bridging this journey is Bharat MedTech Ascent, Bharat MedTech Ascent, advancing research, enabling access, elevating Indian healthcare.
And that's the name of our product promotion program, Bharat MedTech Ascent. Thank you so much.
Thank you, Mr. Satyaveer Yadav. Now we have looked at the 4 segments of the Innovation Full Stack, and it's a greatly ambitious program. And to tell you in some numbers, with all the partners that we have onboarded today, we plan to reach about 100 plus innovations and to convert them and translate them to reach closer to market, and many of them in market itself. With this, I'm privileged to announce that we have with us Dr. Taruna Madan Gupta, Scientist GN, Head of Development, Division of Development Research, Indian Council of Medical Research. And I would request her to kindly come up on stage. I request Dr. Gaurav Singh, CEO BFI, to also come up on stage and felicitate Dr. Taruna Madan Gupta. I request Dr. Taruna to kindly share her remarks and address the gathering, please.
Thank you very much for this esteemed opportunity that has come my way, and I apologize for being delayed for the event because there are so many things happening at ICMR that very difficult to really do the time management. It is just that I have fully surrendered. Whatever comes my way, I will just do that. So we have now the 1,000 clinical trial sites, as you are aware, with the biopharma mission. That is the current objective that we are meeting. So we are making the EFC documents so that we can get approvals of the strategies, how we are going to create these 1,000 clinical trial sites across the country. And of course, with the support from DBT BIRAC, because they already had in National Biopharma Mission some of these networks. And we ourselves had created Intent, the Indian Clinical Trial and Education Network, which is having around 84 sites, including 4 phase 1 sites. And this is how the expansion is happening for that. The important thing that first of all, my congratulations for, launching this whole thing, and that too at a very opportune time when the AI Summit is going on. And India is making the global mark on the AI map. And the important thing is that the niche that this network has found is the niche that ICMR was looking forward to. And so we are thinking of creating, they have a network, we have a network, and we'll create a networks of network. So that is the most important thing. We are not mandated to directly dabble with the industry because of conflict of interest. They are profit-making bodies and we are not. So that is a big bottleneck for government to interact with the industry. And for that, one roadmap is having your own Section 8 company, and very difficult to get approval. We are struggling for last 2 years to have our own Section 8 company. Touch wood, we are on that, last PMO approval we are waiting for, and we are hopeful that we should get it within this month before the financial year closes. And in this, what we are thinking is that the MedTech Mitra, as you are all aware, that MedTech Mitra was created with 18 partners, which are helping the Center for Advanced Research, the COEs, which M. Pragati is also a part of, the IIT Delhi COE. So these networks are creating products now, but how to guide these innovators to take them forward. So the first step was to have the regulatory strategy for them. So the first key partner that we onboarded was CDSU. In fact, Dr. Raghuvanshi was so impressed with the strategy that he said, I don't want to be only a knowledge partner, I want to be a key partner. And that's how we, if you see on the MedTech Mitra portal, we have 2 hands joining and under the guidance of Niti Aayog. And this was a vision of Dr. V.K. Paul, member Health, Niti Aayog, and Dr. Bahl, Secretary DHR and DG ICMR. And then Dr. Raghuvanshi joined the vision, and we had the genesis of MedTech Mitra. And after that, the next step is that you have to guide with respect to these devices development of the benchtop testing, the quality assurance standards they need to follow. So Bureau of Indian Standards joined us. The technologies that require radiations, so we require atomic energy radiation board, so they were onboarded for guiding development of devices. The main thing was handheld X-ray, which is now in the market and has already been onboarded. And then we had the preclinical studies, which are to be supported by ICMR NARF-BR. We have a 100-acre facility, and now which is approved by DST for the GLP accreditation is given to them, and whatever animal studies they will do for your devices and as well as for therapeutics and vaccines, they will be now accepted by the regulator. And the next step is the clinical evaluation, where the niche is being created. So the development is happening at one center, which is our COEs, IITs, 6 IITs, and then we have to evaluate. So for evaluation, we onboarded Center for Advanced Research. So we have around 14 of them, which are only for evaluation of medical devices, including the diagnostics. And then we have now the intent centers as well, the intent network sites. They also showed a keen interest that we would be very happy to evaluate the medical devices, and AI STET and many other survey AI and other things are being evaluated. So almost 10 of them, the evaluation is going on. And now what we have with this BFI initiative, that you have these developers inside the campuses of medical colleges. So this is the real niche that ICMR could not create, and you are creating. So joining hands together will be helpful. You are developing those prototypes. Rest of the framework is there with MedTech Mitra, and we will also be helping you with the clinical trial protocol development, because that is our forte. We can help you. And after this TRL 8, 9, when you reach, your product is manufactured and is out in the market, then you have the plans to upscale it and market it in a better way. You have a full network, which ICMR was not able to support. So we will be signing a formal MOU. That's what I proposed to Gaurav ji as well as to Sandeep, that we should be doing this, so that the things that we were not able to do as ICMR, you are creating that, and we should be able to send all those MedTech Mitra innovators to you for support, and your innovators who are developing those products to MedTech Mitra for extended support. There is another key step which Dr. Behel had recently given in Doordarshan interview about health technology assessment. So after you have done the manufacturing, and maybe you can reach out to ICMR for validation also. So that is another stamp that your technology can get, your devices and diagnostics, that ICMR has now validated your technology. And that validation should happen in such a way that you're comparing your functioning, your efficiency, your safety, your consistency vis-a-vis the standard of care or the predicate device that is available. And once you do that, using that data, we compare the cost effectiveness of your device vis-a-vis the standard of care, and that helps us to decide a cost on which the government can onboard this new technology, and that helps government to take up new technologies. And we have the rural health research centers, which now we are calling as population survey centers, PFRCs, and these are set networks where you can do the field feasibility studies. For example, you have made a device which is for primary healthcare center, but you have tested it in a medical college avenue. Now you need to see whether it will work in the hands of the ASHA workers or PHC staff members. So for that, we have another network, and we also have, with respect to medical colleges, Gauravji, we have a MRU network. And Dr. Behel, your mission objective in mind, and more partners join in, the better it is we will be achieving the goal. And we invite all the innovators to utilize the MedTech Mitra as well as the Patent Mitra, which is our recent one, although we are completing 1 year. But many innovators have reached out because ICMR is offering at its own cost all medtech innovators to support them for filing these patents. They start from seeing whether your idea is patentable or not. So patentability, the survey happens, and then you are given legal support for protecting your patent, and your patent is drafted in such a manner that there is no infringement happening to your patent. So all that infrastructure is put in place so that innovators put their whole mind for innovation, creating more and more for the country, and not getting in blocked by these small issues. Everyone cannot be a patent writer, right? So that is the thing, that we give you a professional support system, and we offer you a financial support system so that you can do more and more innovations. So very happy to be here. Thank you, Rajesh, for inviting me, and thank you, Gaurav ji and Sandeep. Thank you.
Thank you so much, ma'am, for these words of wisdom and for offering to work with us. It's a privilege indeed, and we would soon reach out to you. I would now request Mr. Sandeep Nairwal, founder BFI, co-founder and CEO Polygon, to kindly come up on stage and share the founder's perspective.
Thank you everyone for coming. This was a very impressive event by the team, so all the credit goes to Dr. Gaurav and team. So much work has been done. So many government institutions have been brought together under an umbrella. But I think like between me and Dr. Gaurav, like we constantly keep thinking, like you would be, I'm standing here at an event where so many government institutions are working together, non-profit institutions are working together, and I, I mean, first hear me out fully, but don't take my words that way. But I constantly keep discussing with Dr. Gaurav that, sometimes I hate this setup. Like, there is so much of, we were discussing about, somebody asked the question about egos and how to manage egos and all that. And all of these things then start going into people management. Like people have to manage people to do stuff, and so many of like these navigations are required. And I feel that we being one of the smartest people, I feel that Indians are one of the smartest people globally, but we spend so much of our energy on a lot of useless things, managing people, organizations, so many of these things. And that's why, like in the non-profit institutional, this whole setup, like there is a lot of energy goes out. And for me, many times when I see like or hear some of the conversations and all that, what happens in the background, the team manages a lot of things, and I'm like, I can't be spending my energy here, like in these things, because I can do something. Like as founders also, you can do something much bigger, much more impact. You can do innovations and so many other things, and a lot of energy goes into all of these things. And what you see, this whole innovation full stack program is actually a culmination of all those discussions only. Between that TRL 1 to TRL 8, it's a big graveyard of Indian startups, especially in the medtech world. So many of things, like so many places are there where something or the other, because of some institutional approval, government approval, regulatory approval, something will get stuck somewhere, and that's why nobody is willing to fund these startups also. So that is why we created this whole open, the full stack, the innovation full stack, is that with every step you have as a startup, you have some way where somebody is there to probably push you. It might increase your probability of succeeding maybe by 10% only, at least right now. I think like that will be around that, and hopefully we can make it like 50% your probability of succeeding. Let's say you have 20% probability, so we can make it probably 30% probability to succeed. But at the end of the day, uh, these like the wasteful work that we Indians end up doing in a lot of stuff, in spite of being the smartest people in the world, is is something that I always keep thinking, that how can we navigate better, how can we create a system which helps all the startups and entrepreneurs to navigate through these things. Somebody asked like the question for this, and I feel, because we have some of the biggest government officials also here, that somebody asked that how do we manage egos, right? Like how do we make sure that the innovator doesn't or is able to navigate. And the answers that I was hearing from the esteemed panelists is that we should teach them EQ and all that, and that is like they are coming from the institutional the teaching mindset, that yes, they should be taught more EQ, they should be taught like how to navigate these things and whatnot. And that is true to a large extent. That's a very important skill in life. EQ is a very important skill in life. But it's also like, then again, what we are telling them is we will help you to how to navigate these things, and then you still end up wasting time there. And on a systematic level, what we should be thinking about is that, and this corporate America has solved these things, for last 100 years, right? And that simple thing is capitalism and incentives, right? Like the ego that we are talking about, where like there is, the gentleman has given example that, there is a doctor and there is this person and this person and there is ego clashing between them. How America solves it? It's very simple. It's a startup. Everybody has an equity. And now, even if they have egos while executing their stuff, but at the end of the day, they have a large equity in that entity, and everybody is incentivized to push it. And in various discussions, when I hear, many of the even our incubators are built in. I understand fully. I studied at, I am Mumbai recently. Used to be Niti Mumbai, and I could see between our professors also, there is always a reluctance to execute something, because something goes wrong and everybody will blame you on that, right? So we try to be as risk averse as possible, and that's why like a lot of setups that we have in the incubations and all that is like the incubators cannot engage in the equity structures, or ma'am was explaining that we can do all of this, but we cannot talk to the industry, because if we talk to the industry, there might be conflict of interest and all that. And that is where the root, like I don't know how to solve this problem. I am like talking from a distance, and but that's where I see one of the biggest kind of differences. And this is where, like, to the top leadership sitting here, like we should, instead of like in India, we have a tendency that we hate money, like deep down as a society. I mean, in our culture and the scriptures that we read and all that, we hate money. In fact, like in India, if you see any rich person, your automatic reaction is this guy must have done. So chori karke ही बनाया होंगे इसने पैसे. There's nobody makes money freely, and that is like a mindset. Like, I mean, of course it will change over time, but I think for the government and large institutions, the way to handle is that try to find some ways where you can create these incentive structures so that everybody has a positive incentive to move. And I don't know, like maybe I'm stepping on a lot of sensitivities for some people here, but I'm just saying my mind, like, because right now I'm out of the ecosystem. That's one of the reasons, because of a lot of regulatory uncertainty and all that, I had to move out of India, right? And in fact, like I still was maintaining a large part of my team in India, but then I had to even like curtail down some of my team members also in India because of a lot of non-clarity on some of the things. And I think like this is the part we need to, as a country, as a system, this is the part we need to navigate better. Adopt the capitalism more strongly. We come from still like a socialist background.
adopt capitalism, adopt incentives instead of hating them and detesting them in the background. That's how we will change some of these things. So that's all from my side. Thank you everyone for coming. I hope we are able to bring out few billion-dollar startups from this whole innovation full stack program. Thank you guys.
Thank you so much, Mr. Narwal, for your words of wisdom and giving us lots of thoughts to ponder about. We would now move to the next segment, which is a panel discussion on bridging lab to market technology transfer pathways for biomedical innovation in the AI era. May I request Dr. Annapurna, BFI, to come up on stage and steer this session.
Thank you, Dr. Sanchita. And again, it's not the best taking over from such enlightening session that happened with so many partnership announcements. I know it's been a long day, and I appreciate all of your patience for continuing to be with us. So we wanted to keep the momentum going and end the day on a high. And that's why this panel that fittingly talks about translating technologies into actual commercialization. So I'll quickly introduce the panelists while the stage is being set. I request the backstage folks to please get this arrangement done. Thank you. And we have a bunch of panelists who have years of experience in tech transfer and IP. I'll give a brief introduction to each of them. We have Dr. Purnima Sharma, who's the Managing Director of BCIL, the Biotech Consortium of India Limited, which is a public limited company that is identified by the Department of Biotechnology. And Dr. Purnima, please. Thank you for joining us. And I apologize that the stage arrangements are a little awry right now. And my gracious program director, Dr. Pooja, for having to do the arrangements herself. We also have Dr. Premnath Venugopalan joining us, who's the founding director of Venture Center. And we have Dr. Satya Prakash Dash, who I'm sure is busy networking outside. Priyal, I request you to please ask Dr. Satya. Please join us on stage. And we have Dr. Namita Gupta from FITT. She's the Vice President of IP, Tech Transfer and Projects. All these individuals on stage now have years of experience in technology valuation, IP and transfer. If I go on introducing them in detail, I think I can speak for another hour, so I'll restrict myself. The session will be moderated by Dr. Pooja Agarwal, who's the Program Director for Biomedical Research and Innovation at BFI. And that's it from me. Dr. Pooja, over to you.
Hi everyone. Thank you for everyone who stayed back. I know this is the last panel, and we are all tired. We had a very exciting day, a lot of programs that have been launched. But this is a very critical panel discussion because we have really esteemed panelists with a lot of years of experience in tech transfer, and I really need to pick their brains to this panel discussion to see what next we can do. So all through today, what you have seen is BFI's aim to reduce the gestation period for an innovator who has decided to take their idea forward. How can we help them move through different stages and shorten their gestation period from brain to bench to bedside? Right, so that is the whole thing. But there is one more key component that we haven't gone or touched through today, and that is all the great research that is happening in institutions. Right, we are in IIT. I'm sure a lot of faculty are doing great research, and a lot of them happen to be publicly funded, and a lot of them are actually based on local challenges, the problems that we face here locally. So it is sad that not a lot of those
actually end up going into the market. So the idea today is to see how we can take that, and one way to do so is through tech transfer. And that's the reason we have this panel here, to see what we can do. Researchers are great, and not everybody who's doing research wants to turn into an entrepreneur and take their product forward. But how can we not let that story just be published or given a conference, podium to talk about and not take it forward? So that is the idea. And with that, I welcome everyone. Thank you for taking time and also for accommodating us. And there are a couple of folks who want to rush to catch flights, so I will.
I'm going to give a lift Indian word for Holger here. Prerna, you can join me. Oh, Mike.
So with that, yes. Should we start? So I think first one I would like the Purnima to answer. You've been in this ecosystem for decades, and what I wanted to know, and I've reduced the questions. I know we were discussing what we can talk, but what are the significant challenges that you see in moving IP from discovery to deployment? Right. So, what are the biggest barriers that you've seen in your career dealing with various entrepreneurs, faculties, taking their ideas through tech transfer to deployment?
So thank you. And I thank the organizers for the invitation. So actually, deployment is, a far-fetched story. As a TPO, I think our main objectives has been, to take the IP and, secure them and transfer them. Because as you know, we are into transfer of academic IPs and they are generally at a low TRL. So the objective is to look at them and see the ones which are promising, package them in terms of looking at the technical strength, IP, regulatory, market, etc., and package it in such a way that the industry can have a look at it and appreciates its viability. So that's about all, and then we transfer. Of course, after that we we try and help them in commercialization. But then, when it comes to deployment, there has been a lot of challenges, and the main challenges has been that scientifically most of these IPs are very good, but then there are a lot of gaps. Especially they have not been scaled up, or their workability has not been tested on real field situations. So when we take it through that phase, there are a lot of challenges. Doesn't stand up to the specifications and the claims that were made. Many times, when the scale up is done, so one is the workability validation, one is scale up, so it fails to meet the commercial requirements, especially because most of them have used the best of these reagents, etc., and then when it has to be scaled up, one is the cost, and one is that even the scale of economies don't work out. And many times, even this happens, there has been cases when, especially in the case of medical devices, when the startup actually deployed it, but they had to recall the things because we don't have policies, to fetch them, or procurement is an issue. So there have been a lot of challenges. And largely it is because they are at lab scale, low TRL, and when it has to be scaled up, there are multiple issues. So if you want, you can give some examples, but maybe later.
Sure, I would love to actually. That does lead to the next question for me, Amita. So you've seen probably with IIT Delhi, you have experience. I'm just curious. So as you mentioned, there are technologies that move forward, and there are technologies that struggle. Do you see that there are certain technologies that there is only a certain class of technology or certain kind of technology that may suffer from moving forward, or do you think that such problems that Purnima mentioned exist across the scale?
And thank you so much for the question, and to the organizers for inviting me here. So I would say that all those exist across the entire technology base. So I can't really pick out and say that, okay, this area works, so maybe diagnostic kits work and devices work. And that's an area which we're seeing the maximum growth in currently. But other than that also, if I would say which technologies work, of course technologies which are at a slightly higher TRL level than just a lab scale. Technologies which have a ready use case and who not, struggling to find where they could be applied. Technologies which are industry ready, not just by a readiness level, but also industry adaptability in terms of they fit into the process flows. They fit into the current industry process flows also, because the industry is sometimes very averse to setting up a whole new process flow for them. The workflows, the industry workflows, they have the technical capability to understand them. And one very important point that she mentioned is that it should fit into the procurement also. Because we've seen here, and in IIT Delhi, we've had situations wherein we made the technology was validated also. We were able to transfer it to multiple industries, but eventually it was not commercialized because we could not fit into the procurement. And this is one of the technologies that happened during the COVID time when the need was urgent. It was like a national need and everything. So we were like happy. We have multiple industrial partners to take it forward. But we just could not do it because of that reason. So yeah.
So do you think that, and I would like Premnath also to answer this, but is there a chance that maybe we should be is the technology that is being developed by the faculties in the institutions, because they are not thinking necessarily in terms of taking it forward, maybe it lacks some of those other rigors that we may see with the startups themselves?
So absolutely. I mean, we've seen this, that those technologies which are slightly different, they work well with in the startup ecosystem rather than established industry kind of ecosystem, because there the startups are ready to take that risk. They're not as de-risked, I would say, as the industry is. So we have lots of cases wherein the spin-offs in our setting, they work better, they are happy to take it. And even in some cases, we've seen MSMEs who are more supportive in terms of, I mean, we have some classic examples where I would say that two technologies which were basically at the same TRL level at the institute, one has gone really leaps and bounds when a MSME was involved, versus one wherein we had an established industry player who very early recognized that this may not work, and they were like very happy to drop it and not take it further. So those things happen. An industry outlook, co-development that we call. Co-development is like one of the best ways, I would say, especially in the biotech area, wherein biomed area, wherein industry requirement is clear, the market need is clear, and accordingly we can do our research. So yeah.
Dr. Premnath, I mean, so tech transfer does not necessarily just apply to work that is done at the academic institution. But what I'm hearing is there are certain challenges taking this forward, from validation and to fit and everything in between. In your experience working with startups, do you see that there are certain technologies that transfer well, or is it the similar scenario? And second question for me is that, do the technologies that are developed by startup, whom they want to do tech transfer to other folks, is there a higher success rate in that than going from academic institution?
Okay, so first of all, you need to just define what we mean by startups.
Yeah,
right?
okay, yes.
So when I say startup, I don't mean every new company, and I don't mean every micro, small, medium enterprise, right? Basically, when we are talking about startups, typically there is foresight in the opportunity, okay? And that's what I mean by that, right? And when that is so, they want to get there early, right? They are early, believers in a given potential or a given idea that this is going to work. Now, that, in my opinion, is a great asset for every inventor. I mean, that's the kind of a person you want to befriend, right, as an inventor, because you are also wanting to do science which is a little bit early in the game, and you want to work with such people who are willing to believe that this is an opportunity for the future, right? Now, that said, there are only certain things. So you'll often find that if the technologies are for already known products, right, and you're just a me too, maybe cheaper, whatever it is, right, that may or may not be something that a typical startup can do. Okay, an MSME might do, right, because there the idea is just to earn and grow on earnings. Whereas a typical startup tends to raise money, and the moment a startup wants to raise money, it has to look at opportunities which will scale rapidly, right? And that may not be the kind of companies where you say, this medical product, I just do it cheaper for me. It doesn't work for startups, right? Now, so there are certain kinds of technologies which are better suited for the startup journey. There are certain kinds which are better suited for a typical MSME, and there are certain which are suited for big companies. You can imagine that in big companies, suppose you need a very large ecosystem, existing ecosystem of suppliers, you need an existing ecosystem of production facilities and so on and so forth. You can imagine that large companies might be the right people to take it. But the problem is that they don't approach an average inventor or a researcher, for various reasons, right? So many scientists are developing things and sitting on it and waiting for people to come, right? Because that, the big companies either think that they can do it themselves, okay, or there isn't a champion inside the company who says that, let's bet on this, because if he fails, his job is on the line. Right?
Yes.
Okay. So what you have to understand is that there are different types of technologies. You have to look at different commercialization pathways. Not everything is suitable for a startup. My last point, you mentioned about where does startups really help in translation, right? So if there are technologies which are path breaking and they require considerable investment to advance it to a stage that big companies are interested, that is the kind where startups can really excel. Okay, so for example, you saw during COVID, Moderna and BioNTech, right, doing mRNA technologies. You saw that Pfizer eventually commercialized the mRNA technology of BioNTech, right? But they were working for 10 years before Pfizer stepped in the context of COVID with large money. So we know that in such industries, you need players who bring in lots of money, because 70-80% of the money goes in clinical trials alone, human clinical trials, right? So if you're doing new drug development, there's no other option but to build it out like this, to build an asset out till a large company comes in. But if, say, you're developing an improved tractor, right, then maybe you will, it's an MSME play, or maybe some feature of it, maybe some company, a tractor company might be interested, right? So it's like that, right?
Sure. Thank you, and I will come back because that is very good thought. How do we connect that? But this is now for Dr. Satya. So you have guided us through BFI Biome. You've looked at various academic research, and now you're heading IKP. Where do you think the technologies in this whole gamut, right, be it academic or be it, where do they fall? What is the biggest gap? Is it, so as ma'am mentioned, that there is, some of them don't validate, or some of them don't scale up, right? Or there is, it is not procurable. So where do you think a lot of these technologies are failing?
Okay, thank you, Pooja. First, and thanks to Dr. Gaurav here, and of course our founder, Sandeep. We wouldn't be here if they weren't doing what they were doing. I should do a round of applause for that. Yeah. And this is institutions like this that can really, facilitate what we're talking now. And in my opinion, I think, I'll just step back, and these are all opinions, and I've seen and done maybe, not many tech transfer, but I've seen many. I've done maybe one or two in the last few years. One thing, I just draw upon what Dr. Purnima said, and what my good friend Devnath said. First is, when a big company looks at a technology coming out of the labs, it is using quite a few lenses. First lens is, what Penna said, it will kill my existing market, right? I mean, you know the famous case of Kodak. It was Steve Sasson who invented digital photography in 1975. And eventually he had to break his head against the wall of Kodak for their senior management not to take it up. Because, hey, you know what, we have based out of Rochester, we have the global company. Why are we going to take this, right? And slowly the Japanese came up, the patent was gone, they attempted to do something, that's it, right? Sometimes they take a technology and sit on it. So it is a tech transfer, quote unquote, right? But they will sit on the technology so that nobody else takes it away, right? I mean, let's be honest about here. And there are many things like that. Third is, so it is to Prerna's point, incumbents are absolutely lethargic, slow, they don't want change. If they want change, they will wait for somebody else to do that change. And then hopefully they come with the right, bag full of dollars to buy it out. Like what you mentioned about BioNTech and Pfizer. Similar is the case of Moderna, for example. It was flagship pioneering and early angel investor like Timothy Springer, and DARPA also got involved, right? And when these parties get involved, the first thing they want to look at, and to your question, and I think all our related question is, does this new tech is going to increase my market or take me to a new market? If the answer to the question, both of them is a bit of a negative, then they are not that interested. Second, is it going to survive in the real world? Right? And what is the real world? We all know, it is like Dr. Punima mentioned, you might do something great on the bench. How will it eventually look in if it's a diagnostic company with the ASHA worker, right? Professor Till here from Edinburgh was showing me some interesting product that he has built. And the ability to imagine the product in the hands of the final customer is lacking in many of our faculty. And I think I shouldn't blame them. Right? Why should they think that far? It is the responsibility of a tech transfer organization within the institution that should be advising our faculty, hey, this is a great molecule that you have found is going to do blah, 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 but what kind of formulation it will be in the end? Will it be injectable? Will it be not an injectable? How is it going to be delivered? If it is a drug development company. So that the role of a very good TTO becomes very important. I think I don't want to get into a blame game here. Our faculty don't know this. No, their social contract is to do research. And now we are asking them to look into markets, right? So are we creating a good sizable amount of people in those institutions who understand the market? There will be 1 or 2% faculty who would know this, right? We empower them. But we should also disengage with the faculty who say, hey, you know what, this is, until now I want to run until here. Absolutely. And I want to pass the baton to somebody else. Absolutely. Right? So that's and finally, I think a company, and I help the company take a very early stage technology from a topmost academic institution in India. The kind of discussion I had was very revealing to me, and this happened not in the very far past. It's not that far past, and finally the understanding that my technology, which is working in the lab, and devaluing the industry that is coming to take it to the market, thinking that, hey, you know what, I have spent my years building this kind of that works on the lab. But you know what? You don't do sales and marketing. Nah. Do you even realize what happens when it goes from your lab to a pilot production or to validation, and then they scratch their heads and they go back and then they design something? And I'm talking from a, say, medical device perspective here. I don't think this is where I feel like somebody, Pawan asked a very interesting question, what is the ego, right? This is where all parties have to lower their egos, right? I mean, it's amazing that you build something on the bench. It is also amazing that somebody is able to take that thing from the bench, consulting with the medical practitioner and finally deploying it. I think this is what, I found that question to be really, really good. And this is true for tech transfer as well. Thank you.
Thank you. So, Dr. Purnima, I mean, I understand, and by no means I absolutely agree there with you, Dr. Satya, that faculties are there to do research, and we cannot expect everyone to become entrepreneurs, and then we won't have the 10 years of research for mRNA vaccine.
Can I just come in? Also the culture of the organization. In MIT, where my good friend Premna did his PhD, it will be very difficult to find a faculty who doesn't have a patent and also not thinking about. But across the river, where Harvard is, it will be very difficult to find somebody thinking about actually taking it to the market, right? Same river, one side MIT, other side Harvard. But they don't point at each other with an accusatory, right? Both are happy.
Yes.
And of course, there are medical colleges surrounding it. So that's the cluster effect that we should look at.
Thank you. So, so Dr. Purnima, I was just wondering, so I understand that there is a challenge, right? How what is built in the bench that may not translate later on. But is there a way we can work with the ecosystem that you think would facilitate? Of course, one way, like Dr. Satya mentioned, right? We can have the TTOs in institution work very closely with the faculty and encourage them. Do you think there is anything else that we can do with the wider ecosystem? And of course, BFI being one of part of that ecosystem, if you have any suggestions.
Yeah, thank you. So, as I mentioned, science is good, but the gap is in translation. So when it comes to translation, that's a big word. So it is like initial validation, then as I said, the workability, then scale up, and even regulatory. So all there, and then the market acceptance. So the present problem is that we don't have structured mechanisms for all that. Even the funding is a major gap, and we have limited funding available. So many a times, if it's a challenging technology and we have an industry, who's willing to come in, they'll come in if they have, assured funds to take them forward. Another problem that I see is the KPIs, so for the TTOs. So generally, the present mechanisms are that, the KPIs, they are the performance indicators are like how many patents facilitated, how many technologies transferred, or revenue generated. It is not on deployment, like how many technologies deployed. So probably that is something, one, because then the TTOs will start thinking in that direction also. Although I'm sure there will be a lot of challenges, because just thinking in that direction may not be enough. We need to have structured mechanisms. As I said, the problem is in the low TRL of the technologies, and TTOs can, at best, they can, bring the stakeholders together. But we need structured mechanisms to help those, people who, for example, we transfer a technology for a diagnostic. So all these, it was not stable at room temperature. It was only, because they worked it at 4 degrees. But then when we transferred to industry, they tried their level best to make sure that, it works at 4 degrees at room temperature, so that it can be, for commercial reasons. It didn't. So likewise, another technology which failed because when it was trying to be scaled up, it did not, meet the claims that were there. So what we thought was, if we had a good, protein chemist, some good chemical engineers, who can help in scale up, because the scientists have done a good job, and as from the science perspective is good, but then probably he doesn't have the wherewithals or the capacity to scale it up. But a little bit of maybe technical assistance and technical expertise from somebody who's an expert in that area would have helped in bridging those gaps. So likewise, in the case of procurement, we've seen in medical devices, which was really good. But then they got the regulatory approvals also, and we were very happy that single-handedly those startups, they've gone all the way. But probably 6 months and 1 year down the line, they decided they're not able to compete with the other giants. So if there are some good procurement mechanisms. So as a TTO, probably I would not be able to address all the challenges. There has to be structured mechanisms to help us take it through. We definitely, the KPIs for the TTOs, if they are also includes deployment and all, that will help to certain extent to work with the policymakers also. Some people who have access, some TTOs who have access to even say influencing the policies, it may help. But we need to have structured mechanisms to address all those challenges. This is my take.
Can I add a point?
Yeah, absolutely.
So just the points, I just want to add something extra. One of the things we should be doing, first of all, one of the reasons why technologies don't fly is, or by the way, which is the top reason why startups fail, is that the need doesn't exist. Okay, so one of the important things for us to do is to also educate our scientists and inventors on defining problem definitions well, and the need identification is done well. And there all the clinical partners play a very important role in any biomed kind of activities, because that's the heart of the, if you start well, you have gone quite far, right? Trusting something on somebody and saying, here's the technology, now go and find me, is a very different ball game. I mean, it's possible,
yes,
but I'm just saying that that's a very different ball game, right? So that, I think, is one exercise we should do, right? As an ecosystem partner. The second important thing, I mean, we have to do this, of course. It's also an exercise in most product development, is also a joint activity, right? So biodesign programs do that well, where you have a designer, you have an engineer, you have a scientist, a doctor, so on and so forth, to actually make this happen in terms of put ideas together which are relevant, right? So I think these two are things which we can add to our ecosystem, jointly, and TTOs can facilitate some of these things as well. Just a quick ad break. We've just released a TTO office handbook, okay, with Unido, and it is available freely. If somebody wants it, please contact me or Manish there, right? And we'll send it to you on phone. If any of your medical colleges or anybody wants to set up TTOs or research centers, you may want to see.
Don't set it up now. Please. I think what we should learn from India is you work with the best organization in India. That ego thing. You want to create 10, 100 TTOs, nothing's going to work. Go and work with the big TTO of IIT Bombay, for example, and then have a deal with them. Don't set up your TTOs.
That's a view, huh?
Yeah, so that's a view. Let me challenge this, okay?
No, but TTOs
what percentage of MIT operating budget is licensed? Anybody from the panel or from the audience? Somebody said 10%? Good, okay. Anybody else?
5.
Okay, 5. Okay. Anybody else? 1%. 5 billion is their operating budget. In the last 3 years, I was checking before I came to this panel. They do licensing of $30 million. And only 2025 they did 60 million. We're talking about MIT here. Okay? So let's not get ahead of ourselves and understand that is the technology that we are building. And there are many good examples. I mean, I'm part of Venture Center board. Our board is chaired by Dr. Assis Lele. The NCL has developed a technology that covers the BrahMos missile, right? So DRDO. So what Premnath is saying is really interesting, because I know if military, DRDO, DARPA kind of things come together, thus you know that they're looking at technology which will have some usefulness, and that is what I think we should be looking at. So, sorry, Premnath.
So just to add just one point, TTOs have roles which include also awareness building.
If you want to create
so-
awareness, you can also do without TTOs.
Yeah. So those are things which you might also want to consider. It is not always only the transactions. He's got a point that it's very difficult to get the right people to do some of these things. It's subcritical, and all of that is true. But nonetheless, every organization, TTO is the vehicle for impact for the organization, right? It is the one that helps facilitates the translation to impact. So every director or vice chancellor will never let go that opportunity, right? So they will do it.
So I before you put the mic down, actually, when you mentioned biodesign, so just a thought. Do you think we should, and let me see if I can explain this, can we bring people who are maybe interested in setting a startup, right? But they don't have their idea.
Yeah.
Right? Bringing them and maybe exposing them to the various tech transfers or projects that are available.
Yeah.
And then telling them to immerse in it, find whether there is a utility. They will take 6 months, 8 months. You will know a go, no go. And then if there is a go, maybe they themselves, or we'll have a better understanding whether validation actually is possible, or they take it forward for validation, or they take it to a stage B, right? So it is built on the same thought, but in a way that it's an entrepreneurial motion. What is your thoughts? You have.
So as a general rule, all kinds of tech commercialization requires places where there are useful collisions. Okay, between inventors, technology developers, users, all of that. Okay, whichever way you make it happen, it's always very valuable. Okay, but that said, sometimes you have to understand that people have their own vision of the future, right? So certain entrepreneurs will have a certain view of the future. They're looking for things that will make it happen. That may or may not be the view of the scientists there, right? And we see this a lot. So you look at IITs or IISERs or whatever it is, you will see all the professors are working on something which is quite abstruse or deep tech, right? And the students, they are very interested in Flipkart, Swiggy, right? They know it's not that, but they are the ones who are more successful, okay, commercially speaking, right? So let's accept that. But we have to understand that there is a different view of the future, right? And we should not force it, in my opinion. But those who are interested, it would be great to matchmake and make this possible, right?
Just to add to this, our experience has been, as I said, the institutions, the universities, they are also geared up to, file patents, transfer technologies, and generate revenue. But normally, when we try to, transfer their technology to a startup, and startups, they normally don't have mechanisms to fund them. So they say, okay, I can give an equity, but then the scientists and the researchers, they are not willing to that. That comes as a last resort if we are unable, even after 6 months, so we are unable to find an industry who can pay them generously for the science, whatever it is, even if it's a low TRL. But if there's no such industry willing to pay, they'll wait for some time, and as a last resort only that comes. So that's also a challenge. I thought I must.
Yes, I was just going to ask.
Just to add on to that, that also happens because sometimes it is more a ticking exercise. Okay, was the technology transferred? So if that has happened, so you're happy to do that instead of, at least you're not getting the revenue, but you get that to the name that okay, the technology was transferred. And to add to what Dr. Satya said, so you get maybe 10% of the technologies are transferred, but how many of them are actually commercialized? That's maybe a much lesser number which are actually commercialized. Most of them would fail. So the 1% thing is absolutely correct. Maybe of the 10% of the entire portfolio, 10% are transferred, and only 10% of them would actually then see the market. So that really is there.
So just to add an additional question to you, Dr. Nima, and to you also, since you're working with faculty. So, if the startup would like to take the faculty along, right, rather than just say, okay, I'm taking a complete tech transfer. Let's take along, but here I will also immerse, give my time, and then maybe BFI can help bring the other collisions together, you know, through Brownlee notions that we are trying to play. Right. So would that work, or do you still see reluctance in the faculty choosing in this case?
Yeah, so this is up to the TTOs to convince them, because over a time, you know, there is a trust factor which is built between the inventor and the TTO. So I think this is we really have to convince him, and you know, for that we have to get convinced first, because you know, and then we convinced. I'm sure there will be mechanisms to help them understand that why this is the best means to take it forward. So there are
There is a
possible.
possibility.
Yes.
And yeah, I mean, at least in the IT system, all sorts of possibilities are possible there. You can be associated with the startup as a mentor, you can be as a part of the promoter team. So all those possibilities are there, and we've seen many cases wherein, so of course it's also an individual preference, but yes, and in fact those I think would work better when the inventors are a part of the
Development process, but they are not the ones who are taking it
yes,
forward.
so that of course is better. And
sometimes a good consulting program, sometimes a good industry consulting program is very valuable for identifying the right ideas and the scientists to gear their work towards those and make it useful. So for example, UDCT has some success stories like that, right? Because they have a very active consulting program. Unfortunately, some organizations sort of discourage that, right? Working with the industry. I mean, there might be good or right or wrong reasons, but those are there. And that has been an asset in many places. In the US, MIT started this idea that professors get paid only for 4 days a week, not the 5th day.
That's good.
Right? The 5th
Yes.
day you earn,
Yes.
whichever way you want, right?
Mhm.
And that frees you up to do many other things. So as long as
So
you don't...
incentive also, you kind of...
No, it frees you up. Basically,
but
you can go and choose to work with the company or consult with it or work with your own startup. You know, all these are possible, right?
Nice.
I mean, we have a long way to go probably there, but that is these are ideas for, I mean, eventually ecosystems and policies will shape all of this.
Yeah, let
No,
me
in
just
fact, what we
add
have
to
here-
that. Oh, sorry. Go ahead.
What we have here probably is very different from what he's talking about, because here the faculty are allowed to consult only once a week. I mean, in their year, so that's the amount of hour that you can put in towards a consulting assignment or anything. So yes, that ecosystem, that mindset difference definitely also plays a role.
What I suggest is BFI, Dr. Gaurav here, you study a couple of models globally. Cleveland Clinics has a model for licensing. Okay, what is that model? I don't know. I'm not the expert in that. But MIT has one. Maybe Indian models of what Premnath mentioned about UDCT or ICT now, or IIT Bombay. Look at Cambridge, the real one. UK, what models they have. So once you have those models, and then you can, you can be pragmatic about where we are today and what will happen in 5-10 years time. I think we underestimate the change that can happen in 5-10 years time. I think Bill Gates once said that, right? We overestimate what can we achieve in a year and underestimate what we achieve in 5 years time. And we are talking about startups today. I'm pretty sure 15 years back, and Dr. Purnima, me, Premnath, it was difficult to find startups, and today we are flush with amazing ideas. I think let's be very practical. Look at models like Cleveland Clinic, Cambridge, IIT Bombay, CSIR, NCL, for example, or ICT, and then make the best case for us as BFI to go forward.
Thank you. We are close to...
Premnath, my flight is at 8, when it's yours.
A little later,
Mine is later.
I will ask just one last question to all the analysts. So if we were to redesign tech transfer today. Is there anything, with keeping maybe the long term, as I said, impact, and impact can be defined differently, of course. What is the one thing that you would like to change, if there is?
So one, I think when we're doing the planning, the initial planning, we have to plan for the entire. We have to. It should not be just okay. My research is only till here, but what is the future path? What takes for that technology to reach the market? So you have to define every step right from the start, so that there is clarity in the inventors also. They're not left struggling at the end. Okay, now what? And yes, TTOs have a good role to play in it. So if I can just give an example, when you talk about economy of a product, a lot of times we ask our inventors that what took to create the product, and what they'll come up with only the bill of materials. So there's so much more beyond that, and that is never taken into consideration. So all these steps, I think, right from the start, people can think about, it will be easier to take the technology up to the level.
Thank you.
Yeah. One thing is quite clear, that in the last 20-30 years, venturing as a model of tech commercialization has increased in proportion. New venture creation. Okay. Traditionally, in the US, would have been largely licensing to large companies or medium companies, but new ventures, the proportion is increasing, and even in Europe, I think the numbers are increasing considerably. And I think that is something which we have to keep in mind, and especially if the science is deeper, and then deeper investments are there in science. I mean, but that's also important, because if the depth of investment is not there, then companies who are potential licensees will see it as something they can do themselves, right? So there has to be depth, right, in it. If that is the case, I think ventures will be increasingly important. The second thing, as I told you, if you are handed a lemon, you'll get lemonade, right? So the success of tech transfer depends a lot on the technologies people build, and that depends on the problems that they choose to solve. So it comes down to problem definition first, okay? And a good experiment in this is what, say, GDC is doing at IIT Madras, okay, which follows the ICORP model of NSF in the US, where people are trained to look at value propositions early, and as scientists and students, rather than just pursue science, come up with something, and then say, oh yeah, now what do I do with it, right? Which, by the way, is okay. Huh? It's not that it's not okay. It is just that it is. It's just you need to matchmake at some point between a problem and a solution. So I would do that, and I think it's a good idea to.
For helping me address those challenges. So all those mechanisms we are able to address through maybe some schemes, some good public schemes. That's the only way. But I really genuinely feel that little bit of changes which will help us to make many of those good technologies see the light of the day. So
Thank you.
Thank you. Pooja, can you remind the question?
If you were to redefine,
If I had to redefine, if I had a magic wand,
exactly.
Pooja Simpson, just
Yes.
one thing, what do I do? I change higher secondary curriculum and undergraduate. That's it.
Great.
And see what happens.
So just to add to that, as I said, the KPIs for PTO also have to be relooked. Deployment
Yes.
also should become one important part. And also, just revenue, how much revenue the TTO has generated, that should not become the defining part. So I think if deployment becomes one of the KPIs, then, we will automatically start thinking in those lines, and that will help. That will help in good outcomes. Thanks.
Thank you.
Before you close, Pooja, I work very closely with the Pfizer Scout Hub. Okay. 88 projects he was involved inside Pfizer. And later on, when he became the scouter for Pfizer, he traveled across the geography, including India was part of the geography. And this is 10 years back, so hopefully things have changed. The first thing was the turnaround time that faculty reached out. And if we think out of 500 faculty in an institution, if there are 5, and if it is an IIT, then if 10% of them are interested in building technology for the world, then that's 50, right? And out of that, if those are in a particular industry that an industry is interested in, that's probably, say, just a rough estimate of 5 or 10. But about 10 faculty in the whole of IIT. This is what we're talking about. And out of those 10, if an industry scouter comes and she doesn't get, a foot in the door or even a conversation, because everybody's going to want to talk, you'll steal my IP. No, just talk in plain language and see what happens, right? And so that person got just, they just closed down their Indian thing.
So we have to figure out how to bring them again.
Yeah, so last comment. So as she mentioned, so Lita Nelson had MIT's tech transfer officer had a quote which is, tech transfer should be all about impact and not income. Okay, and that's what it is, and that's the focus of what you do, because at the end of the day, even institutions, right, you will get a lot more out of just showing great results on the ground than maybe a licensing fee from somebody. And they should be very clear about it, because just take MIT's case, just look at the budgets. I mean, people don't refuse them money just because they have impact, not because they see a licensing fee out there, right?
And the last word is from Professor Vijay Chandru, who publicly says that the value of a patent is like a banana. It will rot if you want to keep it in your lap, So, and I love that. I love that quotation. So,
I think that's a great note to close on. So thank you, everyone.
And thank you. I thank the panel. Applause. And on that note, not letting the audience rot either, I will request Dr. Pooja to please felicitate our panelists and.
Yeah.
Pooja, well done.
Thank you. Thank you. Good picture.
Annapurna,
come. Come, I didn't have a picture with you yet.
It's going to happen at the end of it.
Ready?
Thank
you.
Thank you.
Thank you so much. Thank you, everyone. And with that, I'll give off to Dr. Sanchita. We now have a bunch of presentations from some of the faculty and our executives. Thank you. Thank you so much to all the panelists. So this is a long day, so request your patience and attention for a little more time. We have presentations from
very eminent faculty of IIT Delhi who have been working on medical technologies and would briefly present their innovations to the audience. This is very well aligned with the program we have been talking about since morning, the Innovation Full Stack. And some of these innovations may come into our program and be translated and reach the other line in commercialization. So I would request Dr. Dinesh. Please give us a couple of minutes. It has gone there, just check. He would have directly given there, you go. Check. Please be seated. We are going to start with the final session of the day in a couple of minutes. Presentation भी तो नहीं है.
वो तो he will speak only.
He will speak.
हाँ he will speak. इनके पास PPT नहीं है. हाँ he will speak. PPT Dr. Dinesh Ting will provide. Meanwhile Dr. Madhusudan will speak. मैं एक बार चेक करूँ.
पूछ लो उनसे.
PPT नहीं कर.
डॉक्टर दिनेश ला रहे हैं. ये सही बोलेंगे बिना PPT के शायद. ये शुरू करेंगे दूसरा बोलेंगे.
ठीक. वो कोई लाना है
give an introduction about the medtech ecosystem.
It's an honor to now request Professor PVM Rao from IIT Delhi to kindly come up on the dais and talk about the medtech ecosystem at IIT Delhi. This will be followed by very brief presentations on some of the technologies that are being developed here.
Okay, good evening and thanks for giving us this opportunity to present my views. I was asked to speak something about medtech innovation ecosystem at IIT Delhi, but probably I'll go beyond IIT Delhi. So I think we have been part of the medtech innovation journey for quite some time now, working with at least 4 or 5 ministries for very long. DBT, BIRAC, Department of Science and Technology, ICMR, MAITI, pharmaceuticals. Everybody had something to do with medtech. But I think one good thing which has happened is that medtech innovation started very early. But I think we still have to see that full impact of our innovations. Basically, economic and social impact is still we are very, very far. We have quite a few successes, but I think still the journey is very, very, particularly very long. Why I'm saying is that probably our journey would be very, we say, is successful when we say that our imports have considerably reduced, and we are also now exporting a lot of our medtech devices which are actually made in India to the other countries. That is still, I think we are there. So if you really look at IIT Delhi, firstly thanks to BFI for choosing IIT Delhi. And I think one of the things is कि we what to put now? You can do it later. Okay.
You can do that later.
Okay. Okay. As I said, thanks from IIT Delhi to BFI for bringing this particular program. And I think I can tell you that this is going to be fairly successful because what we have seen is for any medtech innovation, you need three types of resources: the financial resources, the physical resources, and the intellectual resources. And in terms of physical resources, I think we had a lot of challenges, particularly going outside for manufacturing and getting our prototypes done from the institute. But good thing which has happened in last few years is the M-Pragati which has come up at IIT Delhi now actually provides a complete chain of physical resources which are required for the medical innovation. So having done that, and in terms of intellectual resources, IIT Delhi has in abundance. Why I am saying is we are about 650 faculty. Almost 1/5 of the faculty are related to healthcare, and this is not just from few departments which are particularly like biomedical or biochemical engineering. They spread across IIT. For example, a lot of people in textile, computer science, mechanical, applied mechanics, they all do medtech innovations. So there is a quite abundance of faculty holding. One of the things which we are also seeing among the faculty is that research used to be the primary I think goal of most of the faculty, but that has changed considerably during last 5-10 years. Every year we are adding 10 to 15 new faculty as entrepreneurs. That means people are not just looking at purely research, but also converting research outputs into products and solutions useful for society. And currently we have anywhere between close to about 15% of faculty have their own startups. So which used to be very small at one time, and I think it will only increase, which is there. And in terms of students, I think the potential is even bigger. We have seen some of the best ideas which actually made social and economic impact not only come from faculty but also from the students. And particularly if you look at student as a broader aspect of alumni, it's even better. World has seen something like 1300, 1400 unicorns in last 10-15 years. 3% of the unicorns came from IIT Delhi alumni, which is about 42 currently, which are both founded in India as well as people who went and did some of these unicorns in US and other countries. So students are actually ready for innovation. More and more students are joining with an entrepreneurial mindset and at least entrepreneurship as a goal. So I think there is a lot of it which is actually a possible in the current ecosystem. And what I liked about this program is the phrase full stack. I think the full stack actually, I think we did have a lot of programs, but they're all trying to address one dot in your medtech innovation ecosystem. But I think connecting all these dots to a full stack was something which was largely missing. So you have a funding for, let's say, idea to proof of concept, then what? Or let's say I get a next grant where I can make a functional prototype or sometimes even MVP, then what? Why I am insisting on the full stock is when you have a funding which is only for a one particular part of your medtech journey, then people also don't look at the whole impact as a more holistic ecosystem. And I think medtech is not about like crossing one of the valleys of death and then bothering about valleys of death. Ideally, if I am a good medtech innovator, even when I am identifying a need, I should have a clear idea of all the valleys of death till the impact. And I think that's something comes only when you look at more holistically, and when you look at, I think what we have seen is people did one and they thought, okay, first let me do this and then I'll see what customer wants or user wants, but it doesn't happen. I think you need to look at the head and tail of your entire ecosystem from product to market. And I think I'm assuming that this full stack includes this complete, and probably that's where the real value comes. And I think also wanted to tell is that I've been in medtech eco, at least associated with quite some time, including Stanford India Biodesign program, and now it's called School of International Biodesign for quite some time in the past. But we also run another lab which is on assistive health technologies. And that's one area where we are able to actually take at least 7 products in the market to a large number of users in 25 countries. And we have seen that this is possible, and we are actually now translating another half a dozen products. I'm assuming that probably we'll also have an opportunity to collaborate with BFI and this ecosystem and share our, exchange our knowledge, both benefited mutually. And thanks again to BFI for bringing this. And I think this is the right time when we have all the resources in place to look at this program and look forward to some successes from this program. Thank you.
Thank you for this overview about the innovations happening in medtech sector and particularly in IIT Delhi and the relevance of innovation full stack in the entire ecosystem. I now request Dr. Dinesh Kalyan Sundaram from IIT Delhi to kindly come up and talk about his innovation, the M Pragati's innovations, and invite other faculties. Thank you.
Is it connected to the mic? So this is a brief of the translational pathway that we have been following. I think we made the same slides in the afternoon and some of you were missing. So I'm just repeating what we are doing. Uh, this shows the technology readiness level from the ideation to the commercialization, and the Namaha program that we have conceptualizing is for taking any of the uh, proof of principle from the post ideation stage up to late validation. And there are things that we are going to do in-house from TRL2 to TRL5, and for the clinical studies and health technology assessment, we are going to collaborate with partnering institutes. And at Mpragati, we have the facilities for the custom design, prototyping, manufacturing, and the testing part. And we have established about 7 manufacturing facilities, and we also have a lab to do the NABL accredited tests, and we have multiple users using the facility. So a brief of what we do is we have divided into 5 different categories: combinatory devices, in vitro diagnostics, implants, surgical instrumentation, assistive devices. And so we are working with multiple faculty members. This is just an overview of what we are all doing. And we are not only doing the tech transfer, but also we are directly assisting for patient-specific solutions, which is creating an impact on the patients. And from the CT data, so these are custom implants, so they go through a different regulation process. And we take from the CT data, we design the implant specific to the patient, and these are validated by both the doctor as well as the manufacturing side. We do additive manufacturing of these implants in-house, and the post-processing just to make the implants are fit enough to cater to the needs. And we also do the sterilization and we send it to the hospitals, and we have implanted about 6 patients this year, last year. And this year we have got the ISO 13485 certification also, and that will help us establish these processes in a more robust manner. And wireless arthroscope is one specific device that we wanted to discuss. So this is a tool that is used for arthroscopic surgeries, which are minimally invasive surgeries. And this can be used, it was tested recently in human cadavers, on shoulder patients as well as spinal surgeries. And so there are many products that we are working in and out with many doctors. And we also have Shahid Malik here and Professor Tapan Gandhi also. So I will invite Professor Shahid Malik to say a few words of his innovation, and then Professor Tapan can come and conclude the innovation sector that we are doing. Thank you.
In my WhatsApp.
Everyone, good evening. Thanks for staying. I'm sure it's been quite a long day for all of you. I'll just quickly summarize what I've been doing here in IT Delhi. I am Shahid Malik. I am assistant professor in SENS. I work in the area of electronic system design and particularly for biomedical application. So I'll just talk about a couple of things that I'm working on. One of which is a capacity sensing based prosthetic device. So it will come in the category of assistive technology, as Professor Rao was mentioning. And we are working with Pragati and EMS to bring this technology to the market. So essentially what we have been doing here is conventionally we follow something called as EMG to control the prosthetic, which is basically muscle functions to generate those commands based on which we will take the action what to do. However, it is an indirect way of controlling the motors in prosthetic, because when we think, we tend to move our hand and rotate fingers and everything to control. So this is what we are trying to mimic. We are essentially using the movement of the amputated hand to control the prosthetic motors. So we are not relying on using your muscles to basically generate those signals. Rather, we are relying on using just the movement of the hand to amputated hand to control those signals. And we are using capacity sensing for them because it's like a touch sensor now. You can just touch the electrodes and you can easily generate those signals to be able to control the prosthetic. We have shown that wherever the EMG fails, and this is one of the most prominent reason of why we don't actually the active prosthetics are not in market, and so they fail because of several reasons. For example, the fatigue in the muscle and the electrode skin contact slowly degrade. So this is where the capacity sensing actually helps, and we have shown on patient that the comfort level of using capacity sensing is far better than what it is with EMG. And the results in different conditions, including fatigue and sweat levels, are also really good. So this is right now in TRL 5 level. We are testing with the subjects in AIMS, and we'll soon publish the clinical data that we are getting. The second one is on AI and developing device for oral health monitoring. This is using intraoral camera as well as machine learning and AI to diagnose different disease, oral health diseases. We have developed this system first for shed matching, which is typically an application, use case of dental application where they try to replace the tooth with a broken tooth with something called as artificial one, and there it's very important to match the shade of the broken tooth with what we are actually placing. And this is the device that we have developed. Again, we have using a camera along with some AI and machine learning algorithm to facilitate that. And we are getting quite good accuracy. It is also in clinical, collection now. This we are working with Maulana Azad Institute of Dental Sciences. And the last project is again on oral health. This is more of an instrumentation project where I'm sure some of you might have already done something called as root canal. It is a dental procedure, endodontic procedure where if they use a file to clean the root. They typically take an X-ray before that, and the rest of the procedure is based on the experience of the dentist. They don't have a live navigation system to see how exactly they are doing, and that's the reason why the unexperienced, the fresh doctors are not really good to do this procedure. So what we are doing here, we are developing a metal file positioning system where we can actually show how exactly the file is moving in the tooth, and based on which the dentist can actually perform the procedure better. So with the initial work that we have been doing, we have shown that we are able to successfully show the file in 2D. Now we are working it to for implant application, which is much a complicated procedure in dentistry, and to navigate the file or the metal moving inside the tooth in 3D. So that will give the dental surgeon a more flexible way to perform the surgery and with more accuracy. So these are a couple of things that we have been doing and related to healthcare. Thank you.
Good evening, everyone. We're running late, so I'll not take much time. Even I'm not sharing my slides with all of you. So just Professor Dinesh told me that I have to conclude this event. Let me first introduce myself. I'm Tapan Gandhi. I'm professor in Department of Electrical Engineering, as well as Cadence Chair Professor of AI. Right now, I'm heading the Department of Biomedical Engineering. So of course, I'm in the biomedical engineering here at IIT Delhi, which is the joint venture of IIT Delhi and AIMS New Delhi. Many of our faculties are working on many different kind of interesting projects, and which have lots of transferable value. So coming back to my lab, what I do at IIT Delhi Electrical Engineering, so I work in three different kind of things. The first thing is that we try to understand the fundamental science, that why this is happening. Second is we try to translate those fundamental understanding to technology. And third is societal impact, that how we can impact the society. So few of the technology which I'm working on, one of the biggest area of my lab is vision related. So we work on to restore sight to the blind. And when the blind start seeing this world, we try to understand how the brain is learning, and which has huge impact in the development of the true AI. That means how we can mimic the intelligence of the brain in the machine. The second aspect of those kind of work is that how we can develop the technology by which we can uh, uh, alleviate the blindness of India. That means how we can come up with a low cost diagnostic technique. And if somebody is suffering with some kind of problem, can we come up with some rehabilitation strategy by which we can restore some of their ability? So in the vision domain, we have a couple of products already we are working on. Maybe we want to take it to the market. And the third one is we are working on, so two of my technology already in the showcase in the Bharat Mandapam. So one is on learning disability, and which was one of the top project in the AI India competition. So now it's being showcased in Bharat Mandapam in AI Summit. And another technology which we're working on, the geriatric population. So we have a smart stick. So when an old person will walk with the stick, will be able to find out the health status of that person. So this is also being showcased at Bharat Mandapam. So except this, all this kind of problem, actually my lab is a little bit of pretty big lab. So we are working on many other medical devices, and of course, maybe the kind of initiative the BFI has started. Of course, this is a very good. Starting from the start, to take to the commercial stage and then impacting the lives of the people is the right path. And I believe that in IIT Delhi, with the IIT community, the BFI will be able to produce many healthcare technology or medtech devices which will serve the purpose. Thank you very much, and thank you very much for coming to IIT. And I also invite you to, maybe today was the short day, maybe the other day you can come and visit our Center for Biomedical Engineering, where we can showcase you many other technology which we are working on. Thank you very much.
We heard about a few excerpts of great innovations in biomedical engineering being developed at IIT Delhi. So with this, we come to the conclusion of this launch event. And sincerely, on behalf of BFI, we would like to thank each and everyone, all the stakeholders, participants, ICMR and DST delegates, the partner organization leaderships, the IIT Delhi for hosting us, and the participation and engagement. So with this, we would like to close and request all BFI members to kindly join up on stage for a group photograph.
This one.